Work our way this way.
Yep.
Ron Wolfson, Scott County Attorney.
Bill Drosty, Dakota County, Fourth District.
Sydney Manabe, Deputy Clerk to the Board.
Tom Donnelly, First Assistant County Attorney for Dakota.
Go Atkins, Dakota.
Tom Novak, Dakota County staff.
Barb Weapon, Scott County.
Dave Beer, County Commissioner, Scott.
Lori Halverson, Dakota County.
Don Oric, Scott County Commissioner.
Patty Welsh, Dakota County.
Leslie Vermillion, Scott County.
Jody Brennan, Scott County Commissioner. This is my neighborhood, so welcome. We'll behave at least.
Josh Daly, Dakota County Manager for Community Services.
Bill Wallow, Finance Director, Dakota County.
Hello, Mary Heyman Rollins, Dakota County.
Amy Lenz, Office of Management and Budget, Division Director, Scott County.
Mary Liz Holberg, Dakota County Commissioner, and I can see Scott County from my living room.
Jenny, who's top you?
Jenny goes Hanrahan and all its glory.
Jenny Grosskopf, Dakota County. Barb Dallas, Scott County Human Services. Marty Fishbach, Dakota County Human Services.
Andy Benish, Dakota County Human Resources.
Mary Beth Schubert, Dakota County Communications and Public Affairs.
Lieutenant Scott County Sheriff.
Joe Dico, Dakota County Sheriff.
Mike Slavic, Dakota County.
Liz Workman, Dakota County.
Dave McKnight, Dakota County Deputy County Manager.
George Fisher, Dakota County Assistant County Manager, Physical Development.
And at the row here, Tracy, you starting to go back this way around there.
Teresa Servega, Administration in Scott County.
Jenny Reynolds, Clerk to the Board, Dakota County.
Can we thank those two for
Scott Wiki, Dakota County Communication.
Tony Sherwood, Dakota County Community Development Agency.
Jeff Smothers, Scott County Employee Relations.
Brad Davis, Scott County Physical Development.
Katie Malika, Scott County Quality Improvement.
Jerry Cruising, Scott County Staff.
Lisa Toner, Scott County Public Affairs.
Okay. We're gonna jump right in. Welcome, thanks for coming, and it's really fun to have this joint workshop together and share ideas, and thanks.
I guess I get to say something because I'm the board chair of Dakota this year. It's something we share from year to year, so. And just want to say that in my time being a part of Dakota County, it's really been a pleasure to have so many great partnerships and get to work so closely with Scott County. The ways that we find to find common interests and share the weight and come up with innovative ideas to look at governing differently to solve problems, and the experts that both counties bring. I'm so grateful for. I've worked really closely with a lot of the staff, and I learned so much. I'll call out Barb in particular, Barb Dahl and Marty Fishbach, who have been so key in helping us with our modernization issues. There's others around the table. I know I shouldn't have said any. Just start naming them. You're gonna leave somebody out, but it's very clear to me that the values that we share as counties give us a lot of opportunity to work together, and I think this is exciting. Thank you to Leslie, thank you to Heidi, thank you to Commissioner Ulrich as chair for this opportunity. Looking forward to getting to work.
All right. Our first topic is comparison of demographics, and who administrators can lead us in this item.
Well, thank you, Mr. Chair, Madam Chair. And we're pretty excited to have everybody together. You know, we've had staff meeting. All the staff that you see in this room have met at least a couple of times, and we're excited to be here to just talk about what we've been thinking about with both the boards. But we thought a good way to start would be just to compare some of our demographics. And there we go. Look at this. They don't even need to have the magic touch to make it work.
That's awesome.
Exactly. So we really want to talk about thinking about together is how could we collaborate? You know, if we really put our heads together what could we do? It's not that we don't have a pre-thought of idea, but I think that starting with demographics just to set the stage is a good idea. You know, why do we want to work together? Certainly, we are interconnected. These two counties are very connected and we're very interdependent when you think about all the things that go on economically and demographically. We think there could be opportunities to realize economies of scale. So it depends, right? There's no easy, clear-cut answer, but there are areas in which we think that's something to consider. And another way to think about it is, could we pool resources to provide better quality in addition to being more effective or more cost-effective than if we did things alone? So just gonna run through, you saw, we made printouts of this big map, which to me, happy to hear what anybody else thinks about it, but to me, it was kind of, when you see it this way, it really jumps out that we are one area. When you put, maybe unless Bill Plain and Story Hastings are kind of a little bit to the side, but otherwise, it's a pretty contiguous area of heavily populated city area. So I don't know, I just thought that was useful as a starting point. When you look at our population, Dakota County, of course, is bigger. That's about 1.5 times the size, the geographic size of Scott, and about 2.7 times the density. And when you look at our population growth, again, just, you've got printouts, I believe, two printouts of this. Did we make printouts? I don't think, oh, maybe we didn't. All right, well, we'll send it to you so you have copies of these charts in case it's useful. But as of 2025, Dakota had 457,000, Scott 159,000. That's about 2.8 times Scott's population is, Dakota's is about 2.8 times the population of Scott. When you look at housing stock, I mean, I would just say at the outset, the through message here is that through a bunch of these slides is, to me, really that Scott County mirrors Dakota, but is a little bit younger, has a little bit younger suburbs. So you're following many of the same growth trends, but just a few, maybe a decade or so later. So when you look at the housing stock here, the thing that jumped out on this particular chart to me was both counties growing in multifamily, but look at that 33% change in the last over 4 years in growth in multifamily in Scott County. So high percentage. New construction, another one where look at that number down on multifamily units. This is the actual residential permits. Look at that, 364%. So you almost quadrupled the growth of multifamily in real numbers in Scott County, where in multifamily. And when you look at kind of what are the key points here for this area, both of these counties have sustained growth over many decades, but at slightly different speeds. And growth, it does create real pressure. You all know that as commissioners and as staff, real pressures in infrastructure and services. Sometimes we are expanding in parallel ways. So to me, the question is, where are there opportunities here that for things that we could build once instead of twice? And of course, tomorrow morning, weirdly, we're going to be together twice in 2 days, is our groundbreaking for Recycling Zone Plus, which is a perfect example of what you've already done together instead of building parallel systems, figuring out how to build it once. The next area I thought we'd cover is household composition. The things that jump out here to me, two pieces of this sort of two sides of the same coin. In Dakota County, you're seeing a lower percentage of married with children, again, because I think we're a little bit, the suburbs started to build out a few decades earlier in Dakota County. And now those owners are aging and are without kids. And so we're seeing a little changeover. There in Scott County, you got 28% of the households are married with children versus 21 in Dakota. And then the flip side of that, you can see that bottom line, that The dark line is households with the single household, so people without any spouse or children present. And you see Scott County still a really high percent, almost a third of the households, 31%, Dakota higher at 35. So it supports that through line message of we're just a little bit ahead of, Dakota's a little bit ahead of Scott in terms of when the suburbs started building out. And a couple
Can
of
you tell us
charts.
what the second to the bottom one reads? I couldn't. I had
Sure.
Trouble reading those.
Want me to read? I know. I
What's the
thought you had
second to the
print outs,
bottom?
and I apologize for
It's a
that.
household with no spouse or partner present with children.
That's me.
Single
child. Yeah.
4%.
So 5% in Dakota and 4% in Scott. Single parent households.
Very similar.
Yeah. And then focused in on just a little bit more on those single person households, very similar, but you see that trending, Scott County's the bottom line, trending upwards. I mean, 23% and 26%. The next chart shows you the actual pure numbers, which I thought you might want to be able to see. Just showing you the numbers living alone, which of course underscores it's not just about seniors, but it is a lot of seniors. And so that of course is driving many of our services in counties. This one is specifically showing you that rise in senior population. And if you look at the, I guess it's a little bit hard to tell, but if you look at the red, it's really showing you that the rise in 65 plus in Dakota County in the decade between 14 and 24, 55% increase. But look at that in Scott County. The rise in 65 plus in that decade, 68% increase.
Yeah, we're gonna go from being the youngest county in the state to one of the oldest very, very quickly. And that is something that we have been talking about studying for the last couple of years. What does that impact on our services be?
So again, question, how, what does that mean about how we might be able to collaborate? Or where there might be opportunities? Race and ethnicity, I thought this one was interesting because we are so similar. Both counties increasing the proportion of households, this is population, that is non-white. So 82, we went from 82% population identifying as white only to 72% in Dakota County. And in Scott, they went from 85% white only to 75%. So both declining the same amount or increasing diversity in this example. Percentage, I should say. So key points here, single households we talked about, that's an increasing percentage and number, and it's significant in both counties. That rate of growth, especially for 65 plus, is significant in both counties. We're both experiencing more diverse and complex communities. And so what does that mean about our service demands? They seem to be changing in similar ways. And what is it that we do that could benefit from closer collaboration together?
Do we have the data? Well, I'm sure we do, but do you have it handy about the single households? What percentage of the single households are 65 plus?
I don't have it at the top of
Okay.
my mind, but we will jot that down.
that'd be
Somebody
great.
will write it down for me as I'm clicking through and we'll figure it out for you.
We'll get it.
Then let's go on and talk just a little bit about median income. Basically, the through line here is Scott County's rich.
I told you, Tom.
Scott County is.
If you want rich, you're the
I don't have it.
A little better off, this is the 2024 median household income, so there you see Scott County at 117,000 median household income, a little behind, there you see Carver at 127, highest in the metro, and Dakota's down at 105, still pretty high, higher than Anoka, a little bit below Washington, and then of course we have, not surprisingly, Ramsey and Hennepin bringing up the rear. And then looking at how does that look over time? I asked staff to pull this so that we would be able to talk about how this has changed over time. And in that last 10 years, there's a big difference. If you look at that increase, Dakota County's increase of median household income, it went up 38%, which does seem, I didn't run the numbers to be able to say definitively that's significantly different than Scott, but it is quite a bit faster growth rate than Scott County at 27% increase. Nonetheless, still richer than us at 117. And then labor force, very similar, 2025 unemployment, 3.6, 3.4. I also thought it was interesting to look at the size of the labor force. Remember that it doesn't include people who have retired, people who have chosen not to be in the workforce. And so 54% in Dakota County, 56% Scott, very similar. Gross domestic product, I just put the definition up there for those of you like me that can't quite remember. What does that mean? It's the total market value of all final goods and services produced within that geography for that time frame. So in 2024, this is the GDP for our two counties. And if you look at the next, that's interesting, but to me, it's more interesting to look at, well, how much is that per capita? There you see Dakota at a higher number, and I don't, it's a little bit hard to see, but in that box, I put comparisons for you. So there's Hennepin County, which, you know, a lot of our economy runs on the businesses and industry in Hennepin County, $149 per capita, and the state of Minnesota is 68. So Scott is still above the Minnesota average per capita, I mean to say. But Dakota's higher. I would assume this has to do with the amount of industry. Think of like the refinery. We have some pretty big industries in Dakota that perhaps we just don't have quite the same match. It's got, I'm thinking that's probably why. So
We have a lot of businesses, they're not a production, they have a lot of warehouse and movement businesses.
yeah,
And that
distribution, that would make sense. I think it's just the refinery itself. Commissioner Jossie will help me remember, isn't it like the 7th largest refinery? It's got, it's
Top 10, I
Top
think
10,
it
yeah.
is 7th, but
so even,
350,000 barrels a day.
yeah. You can just think
Billions of
about
pounds.
that a lot. So a couple key
Yeah.
points here, both counties with strong economies, high labor force participation here and growing incomes. And, you know, asking the same question in about 59 different ways here, but what does that mean about how could government collaboration really affect, support the economies and the business communities? Is there anything that sort of sparks for you, for all of us, about how we might work together? And then, of course, in counties, we know that poverty really drives a lot of what we do in counties in Minnesota. So it's important for us to take a look at how our poverty rates compare. I was kind of surprised at these numbers. I thought that that Scott would be quite a bit lower than us, but we actually are pretty close to the same. There's the state poverty rate on the top line. You'll see in 2024, 10.2% statewide. And then there is Dakota County. I'm sorry, I think I lost the key off of this one. I apologize. The darker line is 7.4, and that's Dakota. And then the bottom line, 6.5, is Scott County. That's 2024 for poverty. And then we looked at poverty under the age of 18. Also, when you think about the services we provide and the things we try to do in the preventative world, this is especially important. You know what I took from these charts, I hadn't looked at poverty rates in quite this way in a little while, but I was pleased and proud of the fact that overall poverty rates for under age 18, look at that, for the whole state has gone down, which is impressive. And remember, it dipped during COVID, and you see it dip especially and then come back up a little bit when there was some kind of aid that went to children, went away, but still that number continues to decline. So anyway, I just was kind of thrilled to look at how that's gone down statewide. And there you go, see our two county rates, 6.9 for Dakota and 5.5 for Scott. So very close, really. And then the next one, housing cost burdens. I suspect you all know this is we define this as 30% of income or more. That's how we define someone, a household that's cost burden. Look at that, we're both both counties at 25%. So 25% of our households have to contribute 30% or more of their income to maintain their housing expenses. I mean, it's amazing that we're the same number, but that's sobering to think that a quarter of our households are spending that much on our housing. Let's see. Then just key points around poverty. We do have lower rates compared to the state, but you all know we all know in this room that it is so important to the work that we do. It's really a driver of so much that we do. And it's still a persistent challenge, especially housing costs, persistent challenge, right? So the way I thought of the question here is, could we, and Marty and Barb have worked together for so long and so well, how do we continue? Is there something about economies of scale? And what can we do with our human services systems that would improve prevention? How could we do that while also containing costs, which we know has been a particularly huge issue for all counties in recent years. I also think it's interesting to look at the number of people on public assistance. So this is the unique count of people, but think about this. This is 23, let's call it 23% of every person in Dakota County and 24.5%, just about, of every person in Scott County relies on public assistance sometime during the year.
And when in public assistance, you're including probably.
Medical assistance,
NAP and.
yeah, you got it. Yep. So anyway, I don't know about commissioners, but I think that the general population is shocked to see these numbers and understand how big that is and how many people we're really serving.
This is Commissioner Wolf's favorite statistic. Every year, he is just amazed when we take a look at this one. And insurance is the biggest driver, right, Barb?
Yes, absolutely. Yeah, something that I think would be worth digging into and understanding better too is what the churn is in that population. Because there are many programs where people are using public assistance for months or a couple of years, and it's a temporary situation. So I think very often these populations get looked at as static and as the same people. And I think it would be good to know what the churn is and where that churn comes from, because I think that could really inform the way that we intervene so that, we can help to, make the time that people exist with public assistance.
Excellent question. This is the unique number. So this is the total number in a year. I think, I don't have to look too far to see our experts who I know will agree with me that everything that's coming at us is going to increase that churn. Because more paperwork. And every time there's added paperwork to these households, which are already oftentimes under a whole lot of stress. Every time you increase paperwork, you create that churn. People, whoops, we didn't get the paperwork in. Now I'm off of MA for however long. And now this is only a partial answer to Commissioner Halverson's question, but this is in a given month. This is how many people, you can't add them all up separately, but this is the caseload in a given month. Now, somebody could be on those, they could be on cash assistance, food support, and medical assistance, but it's giving you a sense of how much our public assistance staff are doing every month. It starts to get at, I think where Commissioner Halverson's going, that it's not only is it terrible for the clients to go on and off and on and off, and then they're missing their food support, and then they are.
That wasn't my point.
Yeah.
My point was that, this is not a permanent situation.
Yeah.
Cash assistance is a great example where there is a maximum number of months that a family can be on cash assistance. Minnesota, the average is lower than that maximum. I don't remember the years. 60. And And so, and knowing that for other programs as well, because I think that it's concerning if we think of this as a static population and the same people.
Oh, I see what you
Because who are just a drain system.
Yeah, and I think to go with that, breaking it up, because this isn't, yeah, it's not just one bucket, because if we look at medical systems, our biggest bucket's there. And there is a significant portion of that group who is static, but there are folks who live with lifelong disabilities, and they're counted in here, and I think when people look at this a lot, they're thinking this is traditional welfare, but let's pull out that static population. And no, we're not gonna hear probably why they're on that, because that's a very different approach than what you're talking about in our services.
Yes.
For the other population. So I do think it's just in addition to what you said, that we need to know the static population, because no matter what we do, they're not gonna not be on medical.
Yes.
Right, but there are other people who are going to come into the system and leave the system, and knowing how to serve them as well,
Right,
so that they can successfully exit the system.
if it's a 1 year average.
Absolutely.
Help them get to 10 months.
And
Yeah.
then how do we serve people who are, like, say, have long-term disabilities, and, the work that you've been doing on the reassessments is really important, because there's things that we can do to be more efficient for that population as well. So understanding who we're serving in that, to me, is really calling out for some efficiency.
Those are good points. I would just add that it's a very low number of people that have a waiver to the 60-month. So you cannot be on Minnesota Family Investment Program, MFIP, for more than 60 months unless you have a waiver, and I'm sure it's the same in Scott. Really low number. If most of those people can only be on for 60 months, you have to have children that are under 18. That's what you're getting at.
And that most people exit that before.
Yes.
The next.
Yeah, we can do more work on that.
So just briefly, you said 25%, so that's over 100,000. You said you can't add these up even though you did because people are on more than one program. We're way short of 100,000.
Yeah.
So figure out how you get to 25% in Dakota County, more than 100,000 on your
Yeah. Right.
average monthly served, even in a bloated number, is barely half, and a little over half of it.
Commissioner Holberg, it's because these are not the same people that are on all year. That you have new people, it kind of is going at your point that it isn't the same people that are on all the time, and maybe Barb and Marty want to comment on that.
Yeah, the only other thing I'm wondering is if these are cases. I know the other ones was individuals, and so like I look at our food support number and that looks closer to the number of cases. So we can have a case that has a mom with maybe 2 kids on it. And so that would count as one in this situation, where in the previous one, those 3 people were counted as like individuals. So that could be.
But double check on that.
But Barb, if this is the average number served monthly, I think to the point, the next month, 100 of these people roll off, 100 new ones roll on.
Correct.
They get to be your unique number,
Yep.
which brings the percentage higher, is what I've learned,
Yep.
Commissioner Holberg.
Yep, exactly. Yes.
Overall, that number is bigger than what you see on a monthly, if you take all the unique ones and add them up.
So that a person, I'm sorry, am I supposed to go through the chair? Okay.
Just go ahead.
So are you saying that if you are on a public assistance program for 1 month, you're in the poverty figure for the statistic?
You'd be using that system or one of those
No,
support.
I get that end of
Right there,
it,
that
but
would
when
be-
how do you get to 25%?
You have to, that is the number of people that during the year, at some point during the year, they were on MA, they were on SNAP, or they were on a cash program.
So we should probably figure out what's the average, not month to month.
Yes, but I think it is also important to know how many for the whole year. it's difficult to say that that represents it very what a monthly average represents it because it's different people. And just because they fall off doesn't mean that they're, if what you're trying to do is measure, okay, how many people do we have using this system and or near poverty? And the associated system, it's, I think, a better measure to look at how many unique people were on that system throughout the year. But it's a good measure of process and how much workload we have to look at the monthly. Barbara and Marty, would you have anything to add to that?
No, I think paying attention to both numbers is important, and I think especially as we move forward and some of the requirements of what we do are gonna change. And so I think thinking through impacts and churn and all of that is gonna be important in telling our story, not only for our work, but to our legislators.
I'm gonna just move on for time's sake. A little chart here about crime rates, very similar. Note that the reporting standards changed, and that's why you see such a funny looking chart that went way up in 2021. But I mean, overall, look at that, the crime rates keep declining, and that again seems like a great sign for our communities. I don't know if the sheriffs have anything else to contribute or want to know.
No, I think that's what we're seeing.
So it's not the fact that we have a new sheriff's store in 2020.
Yeah, you could take that. That would be Very good. Okay, and then we also thought because the jail is a big, certainly levy driver in all counties in Minnesota, it seemed like something to just throw in here to add. And on the left, you see the capacity. Scott actually has a pretty big facility, or maybe we have a small facility. I'm not sure, but look at that. The bed numbers are not that different considering that Dakota has 2.7 times the population. And then you see the average daily population in the note below says Scott County, you've got one pod that's empty, right? Okay. So maybe it was built for
As we-
future expansion.
It was built for the future,
Okay.
for sure.
There's that. Also interesting, sometimes what we think about is how many commuters do we have? And Scott County has more people working outside of the county. I guess that makes sense to me. When you think about where are people going to work, it makes sense that Scott County has a few more people commuting outside of the boundaries of the county. We just shared with you a map of corridors, but Leslie's gonna add the corridors that we forgot to put on here.
I think we're missing 70 and 50 and 8, right? That is the other one in the south central part that when you drive between Lakeville and parts of Credit River there that we missed on the map, so should have caught that one.
I gotta tell you though, 42, holy cow,
Holy cow.
money.
Yeah.
That used to be, I remember traveling through Reno, the biggest little city in the world, years and years and years ago. 42 used to be the longest, shortest road in the state. And now, often, I'll go from PL, probably, and I'll make it 35E north, Green Arrow. Because I love to go to St. Paul, so.
Well, it's because there's no left turn left at 35 south and 42. Only took them 20 years, but then that got it done.
It's nice, it's nice. Traffic management is really working there.
Yeah.
You can thank Lakeville and Dakota County for the interchange at 185th too.
And yeah, try to be reasonable thinkers.
Yeah.
Good question.
All right, and then a couple of just key points here, you know, nothing that this room doesn't already know, but our human services, our public safety and transportation, those are all really expensive systems that the county has a big hand in. We have similar crime rates and public safety demands, and we have a lot of transportation needs that are shared. We know that. We know that by the projects that we do and just when we travel, we know that we have similar needs. So we could conclude that these communities, by and large, we function as one region. And what does that mean? How can we take advantage of this to improve services and efficiency? Just a couple more slides. I know I'm way over time, Mr. Chair, but a couple of slides about taxable market value that we thought you might find useful. And I know it's a little bit small, but we'll make sure you have the electronic version in case you want to refer back. very similar, look at that, very similar in terms of what percentage is residential, 73% in both counties is residential. A little bit of difference about what percentage is industrial versus industrial. See, the green, that hot green is commercial and the brown is industrial, and it seems to me like it's just basically flipped in the two counties. And then this next slide is showing you the net tax capacity of those areas, a little bit higher, higher in Scott County, again, because you're rich.
Yeah, that's right.
Fancy, you're fancy, you got fancy guys. Fancy counties. Yeah, that's what that boils down to. All right, and then key, just the key point differences, residential, it's really, we're suburbs. We're both have primarily residential on the tax rolls and just a little bit of difference in concentrations. So what does that mean? What do our differences mean in tax base and how could that shape collaborative opportunities? And then finally, I just have a couple of slides about organizational comparisons that I thought you would want to see. Our FTEs, 2.8%. So Dakota has 2.8 times the number of FTEs. That's just about the same as our population difference. Let's see, Dakota has 1.9 times the levy. And it's not, you know, we are less when it comes to the levy per capita. We are 0.66. So 2/3 of the, Dakota has 2/3 of the levy per capita that Scott County has, although I bet you say that might change this year. I said that very quietly. And then total budget is 2.7. 2.7 times, Dakota has 2.7 times the total budget of Scott County. I think I just have a couple more slides. Residential survey, you've seen this. The bottom line is we have very similar high ratings. People are happy to live in both of these counties and rate the services well, and as a place that people want to live and retire and raise kids. And so that brings me to the final thought, Mr. Chair, and Madam Chair, which I thought might be something you want to discuss. If we were designing our systems today, knowing what we know, hindsight, what would we have done different? What would we build together rather than in? What do we wish we had done together? And that is it.
Thank you.
Andy,
Well, that seems to me likely gonna be mostly a rhetorical question, given our schedule here today. But does anybody want to make a comment or question before we move on to the next? All right, we're talking about
So
efficiency and coordination of projects.
So that's why we're here today, right? It's kind of exciting to get to talk about this, and Heidi hit on a lot of it, right? But if you're driving Highway 16 or Trunk Highway 13 or 42, you don't even know, right? When you cross from one county or city to the next, people don't even realize it. We share legislative delegates in both the state and the federal. In fact, we adopted Commissioner Helverson one day to go with us, you know. And so there's so much that we share and so much alike. How could we be more efficient and do some coordination? And I'd like to say, as you guys have been talking about modernization, I think that started and the little airport model started sitting in the Northern Service Center on the 5th floor of that room. Mary Beth, Jake, Marty, Barb, we were all there with Olmsted County, which grew to Ramsey, which grew to Carver. I think which really helped push that and that model together. It was working together. It was having those conversations. I think tomorrow you have a pretty big groundbreaking that's been in the works for quite a while. But that is a big, big deal. And then the lower min, not such a big issue financially to us, but again, how do you be more efficient and not have 18 water things going on, right? And have one and be more efficient, and we could still accomplish the same thing. And now there's progress on that, right? Bowser is moving forward with Torkelson potentially to evaluate how you dredge for Savage and Burnsville and look at that differently than having to be a watershed district just for that. So I think that's a positive. So talking, sitting together, looking at these things, I think can lead to some pretty creative ideas. And that's why we're here today. All of these folks have met, they have been talking. I think they've put together some good ideas that with the 12 of your blessing, we'll continue to try to take a look at and move forward. That hopefully will improve our outcomes for our residents and hopefully make us more efficient. And so with that, I think I'm going to turn it over to Jake. He's going to lead off the discussion on the medical director.
Thank you, Mr. Chair, Madam Chair, Commissioners. Public safety, we brought the sheriffs, the 3 sheriff's offices together, Dakota, Carver, and Scott County, to have a conversation about correctional health and the medical director in particular. Just one very congested slide on this particular topic. So sharing the objectives that our collaborative work group with the administrators and senior staff came together. We wanted to look at regional versus county-based models. Scott and Carver have some succession planning needs that they need to be thinking about in the future. Need to consider risk and liability in any kind of a partnership, how that changes that, hopefully for the better, but we need to be mindful of any changes for the worse with liability. Consistency of service, cost factors, and then opportunities for alignment. So we had conversation about our current state, already covered. Heidi brought up the ADP for the 2 counties. Throw Carver in there and it's about 350 on average for the 3 jails. Dakota County requires full-time medical care across that 168 hours of coverage every week. Scott County, I'm not even gonna look at Sheriff Hennon because I promised him I'd fix this. And it's still on this slide that we have a 4-hour coverage gap. I think he would say it's more than that.
Yeah,
And it depends on the day of the week.
Day of the week, and we have on-call nursing handling.
Yes. Thank you. So I apologize that did not get corrected. The Carver County believes they will need full-time care at some point in the future, but all 3 of the counties have a need for that access to 24/7 care. At some point in a 168-hour week, Carver County might need that care at 10 o'clock on a Tuesday evening and 3 a.m. on a Friday. So all 3 of the sheriffs indicated that this was a conversation worth having. Conversation then shifted to, do we look at a private provider or do we try to create some sort of JPA model that's a government solution? And Sheriff Cameron from Carver County was the one who spoke up initially and said the private industry has tried this. One of the companies that they used to use went bankrupt. It's hard to make money in this space. This might be an area where government needs to step forward and create a solution.
And Jake,
Yeah.
I'm gonna interrupt just for a minute. Madam Chairman. Sheriff Lee Corhinen, part of that is, it's just been a change in who you're seeing, right? I mean, maybe you want to speak just a little bit to that with what those needs are, because I think when you talked about that at the first meeting, who we're serving is just different, right? How many people need this?
Yeah, I think when I started in our jail back under the 35-bed facility, you had a couple people on meds on your floor maybe, and now it's 40 to 60% or more of our people are on meds or on addiction meds and all the different stuff that comes with this. So it's just a huge lift, the amount of ER visits and medical needs that are inmates would need each day.
And roughly, I don't know what this exact number is, it's over 30% come in with some sort of mental health disorder or chemical use disorder. With that comes a lot of medications, like the sheriff said, where we need to stay on top. But if you roll it back for us, even 10 years, 15 years ago, our deputies were providing the medical passes of the medicine. And you know what could come with that, with mixing up a med here and there. So along with the liability and risk that comes with it, you have to have oversight, you have to have good staff in there. Obviously, so, but we have seen it, we built the unit in Dakota County just for that purpose, the integrative mental health unit. And also for substance use disorders, to put those that are in critical need in one area so we can provide that direct care.
So we have seen the need and we've addressed it at least with housing, but as far as supporting that with medical staff, that's a need across the entire state, not just our counties. So this is something we need to keep, full attention on and address.
Yeah, I know that the three of you all hit on just the change in the clientele and what the need is. Obviously through a big issue here just a couple of years ago. So we had our jailers delivering medicine too at one point, and so that risk is just too high now. So I think the model change, the data is really there to call for it on who we're serving and why.
And I look at that question, does the JPA increase or decrease liability? And, you know, one critical thing that you have to have is consistency and uniformity of training and procedures to make sure that they're all together, that they're all doing those things, training procedures in the same way.
And that's kind of the benefit of the regional is now it's one medical director covering 3 jails of adapting to a new way of business for a new need versus all of us on our own trying to reinvent the wheel each time, whatever. But yeah, I think there's good consistency there to have some oversight that's kind of looking at all of it. And like the philosophy we can have is now you're running a 350-bed jail, so you're gonna you'll have more experience, more knowledge by thinking of it as one big kind of operation under the medical consultants.
And Sheriff Cameron mentioned the drug task force model for us in Dakota County. If you can think of our Dakota 911 dispatch center, that's kind of the same model where there would be a board with oversight of a nursing staff and medical director and everything as far as this is the vision, as far as the 3 counties overseeing this medical staff. And if Luke's team, the sheriff's team down there is running short on nurses and within, underneath that umbrella, that board, we could, if we have capacity, they would then go down there and they wouldn't be missing a beat because they wanted the same oversight and direction and things like that. So the efficiency would improve, obviously, because we're operating in silos right now. As we did before with dispatch and consolidating, it's shown to create efficiencies and consistency. So I think there's opportunity there.
In terms of funding, how much federal funding or state funding are we able to tap into for chargebacks for healthcare? Are you charging back MA and Medicare, or is it just, I mean, I know that they're not paying for the drugs that they should be paying for in terms of when people with substance use disorder end up in jail. And so is that, if we continue to work for that, would that be something that we'd be able to start charging back and get more revenue for? I mean, I think it's one of the reasons nonprofits can't make any money in this space because they don't get reimbursed.
Yeah.
Go ahead.
Yeah. And also, the state of Minnesota in the 2024 legislative session passed a pilot for 1115 waiver. 1115 is just related to federal guidance on that you have Medicaid exclusion that you can't charge within the jails. And Scott County was one of, I think, 4 counties across the state that are part of the pilot program. So hopefully within the next year, the state of Minnesota will be able to bill or get approval to bill through CMS, and will be one of the jails that will be able to hopefully do that. So through that pilot project, and I think across the country, it's typically been medications, case management, some therapy, a little bit more on the mental health side than maybe the full array of nursing care, but at least it's something and it's a start. And so, you know, hopefully that will be expanded to across the states. I don't know if we went to a JPA model, how that would impact the pilot, but certainly something to think through.
Thank you.
I was thinking about the regional model and that's very interesting. And I'm curious, is there anything that would preclude us from being able to do that? Are there steps that we would need to take legislatively? We could do it.
You know, we're
We just could do it.
Yeah.
Care of our inmates. So.
We could do it.
We don't believe there are.
And potentially it would still be like minors. Joe's nurses in the building doing it,
Right.
there would be in a JPA that they would be able to job share and stuff, and then this medical director and or some of that clinical type stuff would be a care research, but yeah.
And everybody would have the same policies, procedure, like that it would be standardized and all of that.
But if we had an emergency and the nurse was over in Dakota, we could call and they could do it because we had the same procedures, the same policies, right?
Right,
And
and
so-
you get out virtually.
Yes.
And are there models or is there a recommendation for how the board would be constructed?
As far, probably just the same Madam Chair, the same composition of any other joint powers agreement. In the case of Dakota 911, all the stakeholders, so I assume would be, maybe it's county commissioners, maybe it's public safety. Whatever composition the board would feel it need to be to have that oversight. As far as direction, would be obviously budget side of it, liability side of it, probably county attorneys have some, at least the advising side of it too, so. We haven't gotten to that point as far as what that board would be, but there would be direction and oversight as far as more than just the budget, but the direction and the personnel. Shared liability, there's a lot of logistics that go into this too. It's not as easy as I wish it was, but with that said, I think it's thinking big, which we need to do.
Yes.
And be bold. And that's how we can make some different, more changes because we don't have to go far to find out that that's probably the highest risk and liability our counties carry is inside of our jail. And we're not going to reduce and completely alleviate ourselves from that risk, but I think we can take some steps to minimize it.
Do we have any other models? Either regionally in our area that have done this with other counties or even through the US?
So Madam Chair and Commissioner Rowland, we're not there yet. So you're gonna probably be asking questions. We haven't gone that deep. We're here to give you some high level ideas. And if you say the 12 of you, we want you to explore the jail model, that's what we would bring back to our next meeting, right? That this is what it would take. This is what it would look like. We just aren't into some of those steps yet. There's research that needs to be done and evaluations and recommendations. We're at
I'm curious.
Not that we didn't try. We had Gil and Andy and Jenny and 1 hour, I thought we almost figured all of it out.
In 1 hour?
So Leslie's right. We have additional work to do, but the 3 sheriffs sounded interested in it.
That's
And
really
that's why we're
interesting.
here. We can get it.
Well,
to go.
It's not like me to ever go too deep in the weeds, so I apologize. There's a lot of interest.
I do think that as we explore it, to really, I think about kind of AMC and NACO and, key federal initiative has been that inmate exclusion policy for Medicaid and like, would there be some opportunities, like new model, new thing? Give us a pilot here to try, because it would be nice to build back some of these services to people who are on Medicaid and eligible anyways.
Yep.
So I just think as part of the exploration, it may come later, but it'd be really good there might be some grant opportunities or some pilot opportunities to help make that work.
I wonder if there's a way to share some of the operations that with, whether it's sharing the medical director or some elements, but not the whole operation. I mean, I can just think of the difference of design of jails. I mean, for example, in Scott County, we had to put nets in because somebody jumped off the second level. I don't know, maybe another jail does have nets. I mean, and just having the shared liability seems to me to be problematic. But I think sharing significant operational elements potential there.
Yep, the medical, right? That's it.
The medical.
Medical director.
Okay, all right.
Anything else?
I like it.
Were you, the other records, are you?
I'm just.
Oh, okay, all right. Thank you. Any more on this one? Okay, we're moving on to the geomedical records.
I guess, may I ask just a procedural question? So we're considering these options today. Is the intention that we're gonna go back and talk in our own board meetings? Or are you guys looking for immediate feedback, or what is your feedback loop that you're looking for from commissioners?
Madam Chair and Mr. Chair. I think we're looking for some immediate feedback that we're on the right track, that you want us to keep going, and then we will also have discussions in our individual boards.
So I think more exploration on this is something that's of interest to me, but I can throw it out to others. Seeing nodding heads.
Yeah.
To do thumbs up, so.
I would just, that somebody brought up Dakota 911 as an example. Its operation might be inefficient, but its governance is not. And so I, set up a whole bunch more meetings and,
It's better than it used to be.
I know, but some people, in my mind, Dakota 911 and efficient doesn't
Right.
click, but.
Well.
Yeah.
We're
More of the structure. It's more of the structure.
Yeah.
We're gonna say this is worthy of further explanation unless there's anybody objects not. Okay, so if you want to say something more?
Well, I think that should be kind of an overarching thing as we try to figure out where we can be more efficient. There is always that parochialism that this room, that you have to get over. That's a classic example with Dakota 911, that, people and communities didn't, they knew it was more efficient, it saved money. However, it wasn't the way it was done before. So I think that as we continue, whatever we choose to do, you have to let some of the stuff go. As we make forward this, if we're gonna try to have it be exactly like Scott County's always done it, or exactly like Dakota County has always done it, we're wasting our time.
Right.
So we have to go in that, as we look at what we do here, and I think that we have a willingness to do that, but I think that is going to be our challenge today and beyond.
Yeah. All right, let's move on to the jail records.
Or just click it.
Can you click that forward?
Oh, I don't think I think it's just a bit. So the reason this one is here is we haven't done a lot of work on this one, just wanted to bring it to your attention. So you have, your JPA, we actually right now for the Dakota board that doesn't know, we're actually working with Hennepin County right now on our dispatch to go on to the same system with them, hoping by the end of the year, it might be close. But that is gonna be a change we make. But one of the things that we discovered in our meeting was that Harbor right now, Harbor County is going out for, an RFP for a jail records management system. I think, Joe and company went out for an RFP last year and decided you weren't happy with it. So you're gonna be reevaluating your jail records management system. And we are in the process of gathering our data and our requirements for a jail records management system. And so one of the things we just wanted to make you aware of is that we are actually going to look at and talk to both of our neighboring counties and look at, is there a way, should we be on the same system potentially as we do this, especially if we're going to look at the medical record, things like that, and where does that belong? Should we potentially be on it? We move people back and forth through our, what do you call that, civil transport, back and forth. We have to check people in and out of jails and things like that. Is there a way to be more efficient? So one of the things we just wanted to make you aware of, as we are all three in an RMS system and looking for a new system, potentially would it make sense to be on the same one in the South Metro? So just bringing that to your attention.
All right. Emergency management and preparedness.
Hey. Yeah, so I'll take the lead on this one. Similar to the other groups you've heard from, we also pulled together representatives from the 3 counties to talk about emergency management and emergency preparedness. As we initially were looking at efficiencies we could gain around that, I think we were looking at not just, could we collaborate regionally, but also within our organizations. Is there duplication between emergency management and emergency preparedness? Emergency preparedness and emergency management are both largely funded with grant money. In 2 of the counties, emergency management sits in the sheriff's department. At Dakota County, it sits under our risk umbrella in central operations. But as we talked about that a little bit more and explored opportunities, it became very aware to all of us that there is a lot of prescriptive language in statute and also in the grants that don't allow us to collaborate or share more across emergency preparedness and emergency management. So that was one of our key takeaways, was that perhaps there's some legislative priorities that we could look into a little bit more and champion for, to see if that would allow us to
spend that money more collaboratively and a little bit more strategic in how we're doing that. Another key takeaway was that we are already doing a really good job of collaborating, particularly in the areas of emergency management and emergency preparedness within our organizations. And even across those lines, we've got regional groups where emergency management from Carver and Scott and Dakota, they're all collaborating, same on the emergency preparedness side. So we felt like we've got really good collaboration that's happening there. But beyond that, we thought there was large opportunity for us to do more in the way of some regional exercises where, you know, Dakota County is not doing the same exercise that might be going on in Scott. Maybe we combine forces and do something collaboratively. So we're going to explore that a little bit deeper. We're also looking to explore more in the area of specialized expertise. So perhaps, you know, Dakota could have somebody who's more expertise in the area of flood management. And maybe Scott has someone who's more skilled in the disease prevention or something along those lines. So we talked a lot about sharing those resources as opposed to operating in a silo. So that is another area to explore. And we've agreed to meet again. We're going to talk some more. I don't know, Barb, am I overlooking anything that stands out to you?
No, I think that's a good, I think back to Heidi's original question, and if you could design it the way you really needed it to, would you design it this way? And so I think that was the part that we didn't really get the chance to fully explore, but left all of us going, maybe, especially when you have these grants that are so prescriptive, that maybe if we, is the reporting kind of worth the effort?
But, and I think we missed part of the emergency management from Scott in that meeting, somehow missed a connection there. So I mean, I even think providing backup at times when you're down a person or up a person.
We talked about
Can we do those types of things, especially now, you know, when you have 7 to 9% of your workforce down at times? Are there things we could look at differently to do that way that are a backup that help? And so we need to have that group meet again, I think, and Luke made a good point at our last team meeting on that, so.
Any questions?
The information we're receiving so far, it seems like some of these are gonna be where you're just informing us of the good work that you're doing, you're beginning to do it together and just telling us about it. Other one, like we just said, you want more direct feedback, let's go ahead, let's look at that further as potential. Is that, we have it right, that some of these are just gonna be informational on what you're doing all of it and continuing?
Mr. Chair, Madam Chair, yes, and if you see something, you know, that you just really don't like, we want to know about that now.
Okay, all right.
And I think this one might have some legislative discussions that would come around later as this specifically delve into that maybe we jointly want to move forward if we want to collaborate.
I find that very kind of intriguing because I think it's, I think that there's many folks out there, you know, from the public, from other levels of government who have said, go find ways to operate more efficiently. It'd be a really great story to be able to tell at the Capitol. And, you know, trying to figure out what barriers might be out there to doing that. I'm intrigued. I'd like to learn more and see if there's other opportunities, but interested if anybody else has thoughts on it.
Madam Chair, I think, is there a benefit to us in applying for the grants? Because you said a lot of these are grants, are from grants, but the collaborative nature of this, would we score higher? Would we get more money? You know, those are just pure things that I'd be curious about.
All right. Go
I
ahead.
guess before we go on, we go to a new category, right? Can you back up train to the RMS? That was like the quietest section of this particular, we have all many faces in the room that is there looking down at the boys in brown and white down there. Does that have legs or is that just a extra plan?
The GL management.
Oh,
Yeah, I mean,
just
just ours,
start.
we're interested in.
Because that's the one we're looking at, Henry, right, Leslie, that particular piece? No, okay.
So right now, our CAD system,
Yeah.
so we're talking dispatch, that's the one we're going with Hennepin, and we will be joint with them hopefully by roughly the end of the year is the target here. But we also have to have an upgrade. The next one we're out gathering requirements for and doing process mapping on is the jail records management system.
And Dakota isn't roughly that same.
Dakota's a little ahead of us. They went out for an RFP, but weren't happy.
didn't like
And Carver right now is out for an RFP.
Okay.
So we're all kind of there, if we could make the timing and think about
Right,
it
right.
together.
And understanding that all of these different, everything we're talking about, to some extent, what Mike was talking about earlier, like. Things can be chirpy, things can be, well, this is how it goes, you do it that way, you like yellow, you like orange, There's always gonna be hurdles to many of the things on this page, but still worthy of running the race. So I'm just curious, is this something worthy of running the race also because it was very quiet?
And
Well,
it's
this is an example of one where I took that they're telling us that they're beginning to have conversations together on this.
and,
It wasn't a hard point of
On the
view.
RMS piece.
Yes, and we didn't really have to give, unless you're really objective, I didn't have to say much.
and Commissioner Beer, I think the reason it's a little behind was we didn't have a separate meeting on it. Because we didn't know Carver was out for an RFP after that first meeting. If we had known that, I think it would have changed the discussion that either Danny or Jake had with their team when they met. So it's a little bit further behind because it was really at our second meeting, which was just last week.
Yep.
Or a week ago, that we found out and had that discussion.
So Dave, I'm glad you brought it up. This is one that I sense as perhaps among the most significant opportunities we have. And I say that because yesterday morning I got together with my three chiefs in the district I represented. They asked for the meeting. They apparently are tracking our agendas, which was very impressive to me. Because nobody else does. So I was waiting for the reaction to be, don't do this, right? I mean, you're getting into our weeds or something like that. It was the exact opposite. I mean, it was enthusiastic and they compared to, apparently there's some national firms that do this kind of stuff. You all would know better than me, but that are very expensive. I mean, like exorbitantly expensive and don't give the interoperability, the ability to communicate with one another. They're talking about Washington County was trying to communicate with Woodbury or somebody. There were a couple of communities in Washington County that were trying to, they both have the same system. Paid for by this national outfit. And they can't use them to communicate with one another without paying another $500,000 or whatever the figure was. It was just, I mean, it was some gargantuan amount of money. I'm like, for records management, for goodness sake. So this is one I was hopeful that we could lean into, and I gather it's more in its infancy in terms of the development. But there may be a real opportunity in this one. There may be opportunities in other ones as well, but anytime cops all come together and say the same thing and they're pulling in the same direction. No offense to cops, you guys always get along so well and you're always pulling in the same direction, but it seems like this might be an opportunity.
Yeah, thank you. All right, we're on to human service operations.
All right. Thank you. There are 4 items in the human services operations area, and I will just say that these are sort of the first 4 that had some immediate energy that we wanted to explore a little bit more. There was quite a longer list of items, so there is like an other topics that I would say we're still thinking about and exploring. One just very positive piece of this whole process is I think it's really gotten my, creative juices flowing. And I would say, I mean, I could probably say the same thing, and same with my team. So I think we're thinking more creatively about what other pieces we could do. So, but the first 4 we're going to talk about are the ones that have kind of bubbled to the top. This one in particular is one that it's really a timing thing that this would have bubbled to the top. This is really a relatively speaking, it's a pretty small program. And what it is non-emergency medical transportation. It's required by federal Medicaid law. So it is a Medicaid covered service for medical appointments. And just as the title says, non-emergency. But non-emergency doesn't mean not serious, you know, non-emergency could be going to chemotherapy, it could be going to dialysis, so it's really it can be quite a very serious, service. In Minnesota today, this is operated by counties. And counties do it different. So in Dakota County, we are part of a consortium with Hennepin County. There's 12 counties as part of that consortium. In Scott County, Scott and Carver do it together. And Scott County staff were the ones that were facilitating this. And Barb is going to correct me if I misspeak. So that is how we're doing it. But the reason why this really bubbled to the top is because of recent legislative change. So in the 2024 legislative session, the state said, hey, I think as a state, we have some economies of scale, and this should really become a state-run service, which counties said, that is a fantastic idea. You can take that right off our plate. We would appreciate that. And it even could save us some money because the non-federal share, just like our other Medicaid administrative costs, is a county cost. So we all like that idea. So this was in the 2024 legislation, and it was set to begin July 1st. The state is wrong, 2026. So it's just set to begin in 2026. In 2 months. In 2 months. In 2 months. Counties were asking the state, could you give us an update on this? Could you give us an update on this? I would say this is like a 2025 that we started this conversation. And, you know, they were probably a little behind, but they finally got the RFP out to find this vendor that would do this for the whole state. And they decided they didn't like anybody. So they shut it down and said, we aren't going to pick anybody and we're not going to reissue the RFP. And so they sat back down in their chair. That's figurative. So it has created that's why it bubbled to the top. Scott County has, and I hate to speak for Scott County, I might turn it over to you in a moment, but Scott County has some unique circumstances where they had taken this out of their budget. The staff are no longer going to be here. They're retiring. So it really is becoming an issue for Scott County. It is also an issue for us, is what we learned, because with that July 1st date coming, we would no longer have the legal authority to provide this service. So that's why it is front and center for us. What is a likely solution is the legislation, and this is happening in the legislative session right now as they're trying to figure out the fix. So one fix could be that they move it out a year. The state is advocating for it to be moved out 3 years so that they have more time. And in the meantime, we in Dakota County would be able to stay on this consortium with Hennepin. And maybe I'll just have you speak to what you're thinking about in Scott County.
Artie, what would it have saved you guys at $10 a trip or $9 a trip? You know what it would have saved in your budget? You would have been 50% too, right?
Right. Right. Yes, probably about 100,000. Right. Mm-hmm. Yes. Yeah, so for us, because we operated it ourselves, and we did have staff that were considering to working for sunset that part of their life. So we had taken it out of our budget, and so has Carver County. And so we actually have reached out to Hennepin County to see if we could be a part of the consortium that the other Metro counties, and because they right now don't have legal authority to enter into a contract to operate this, they're unable to do that right this minute. So there was a letter that was drafted and sent, and Dakota, Scott, and Carver County administrators signed the letter, just encouraging the Commissioner Gomney of the Department of Health and Human Services to just be aware of the legal authority, the fiscal impact of this, and then operational continuity, because we have people, again, as Marty said, like this is just a nice tablet for the people that actually rely on this, that cancer treatment, dialysis, like this is a half income for them. So, so that is, we have not heard anything other than we know that there is a proposal to potentially move this out 3 years. That would help us with the cost on this, but, so perhaps, as we enter into other conversations about what does it look like to transfer things to the state, potentially a cautionary tale of what to think about and how to think about guardrails on that movement of service. So,
So the three of us sent that letter, what, a little over a week ago, and we still have not heard anything back from them that way. They haven't. So did they have the money in their budget? Are they going to like pay us counties then for it? They must have budgeted for it if they were gonna take it over.
yeah, I mean, they budgeted a state cost savings, so I don't know how that looks like for department budgets or how that. See, other than savings. So.
So do we know how many people are affected by this?
We give last year in 2025, between Carver and Scott County, we gave 40,000 trips.
But how many, some individuals have a lot of trips.
They do, somebody, yeah, I don't, we could get that number from
Probably.
Alan and look at the number.
Getting down to under 10,000.
Yes, we can do that between Scott Carver. The number of trips for Dakota too, yeah. Yes, so that is, that's why that one really rose to the top and whether or not that's something that we could do together. So we're staying on top of the legislative piece. And of course, the fiscal and the biggest piece, of course, we're going to be paying attention to is how to have that continuity for the people we serve. So we're like the pieces that we're looking at. The next topic is Min Choices, and Min Choices is a common assessment tool in social services that serves multiple populations, so people with disabilities, mental health. And you had a slide earlier, Heidi, that showed the trends for older adults. This is also a tool that is used with older adults. So it's a comprehensive tool in more ways than one. And it's mandated. It's a mandated tool. When you look at Min Choices, this is one where we're trying to figure out how can we just have, how can we do this more efficiently? It tends to be, and this has been our biggest struggle, I would say, with Min Choices. It tends to be, a math problem in many ways. So it takes about 1 to 2 hours to do a new assessment. It's about 8 hours to do the whole process. And so you need to, map that out, and that's how many staff it really takes. It is reimbursed pretty well from the state, so that is helpful. There's a difference between assessments and reassessments. Assessments just means that it's the first time that you're doing an assessment with somebody. And that's where you can see big backlogs in Dakota County. We have a backlog that luckily is going down, but we still have hundreds of people in a backlog right now. Reassessments, we don't have a backlog, and the reason for that is if you don't reassess in a timely manner, people lose services. So you really have to prioritize reassessments over assessments. So that's kind of the context for the whole piece. So the question we really asked ourselves was, what efficiencies or program changes are within our control that we could do across counties? And that was really what we challenged ourselves to do. And I think that the early takeaways on this question was really trying to compare notes and look at tools and ideas that either manage the backlog more efficiently or maybe do some pieces that just make the whole process more efficient. So as an example, I believe there's a tool used in our county where we do a video that kind of gives all of the information, and then the person doesn't have to be present during that video part. So it just speeds up the process, and it shortens your 8 hours to maybe 7.5 hours or whatever it may be. So those are the kinds of things that we're sharing across counties. And I would say next steps for this is we're just going to keep, again, as mentioned earlier, we had one meeting to talk about this. We had some great ideas from the various counties. And so I think we're now in the process where we're sharing tools and trying to figure out if there's some help there. Anything you would add? Yeah, I think just in, Olmsted's done a nice job, I think, of just the approach with clients on just an educational piece on just that you're gonna need to have medical assistance in order to have a waiver, and there's income requirements that are attached to it. So including some of that on their, I guess, front-facing documents on their website and having form. So I think there's some pieces there that I know our staff are following up on. So I think it's always good to just kind of share information back and forth on how to improve that, so.
Commissioner Wolf, that was your favorite thing, right? So we are putting that, right, on
There, yeah, Brittany was following up on what those details are.
what that would look like, the question, maybe a suggestion that.
Yep.
All right.
Having gone through it, I know that I've gone through the in-person and the call. I mean, really a call person, you don't know if you're talking Scott County, right, or not. And you're getting service. And anybody, not anybody, and I know my choice person was really good, but does it need to be, Scott County?
Well, I think the state has, right now there's some legislation on potentially having the state take a piece of Min Choice's work. So that's an interesting idea. And is there more of a front call center piece versus that they could handle versus, I think their proposal of taking 50 Min Choice's people and having them do work some of their backlog, which I think might have some logistical challenges, but that's an interesting point too.
Barbara Murray, do we have the number of people that go with it in the end? We have to say, you don't qualify because you don't qualify for MA. Do we know that number?
We do. I don't have it off the top of my head. We do have the breakdown of what happens, how many wait, how many don't qualify, how many hop off, how many pass away, how many, we do have kind of the outcome. So.
And that is one of the options in play with legislative change right now. Making that change and figuring out how to fix that problem. And that's being discussed as one of the menu of options.
Right. So instead of our kind of, I would say is approach of saying, here's what could happen, having it be policy so that they have to meet like the state technical review team's determination of disability status or income status, that makes that a harder, piece to navigate for the, I don't want to say harder for the individual, but a more concrete way.
And we provided that data, so they see that 30% that go through this don't make it, or whatever the number is, because 50%, I don't even know.
Way less.
Yeah.
The other thing I just would make mention of this space is we're talking things we can control, but I don't want it to be lost how much work has been done, and Barb has really done a great job leading around the reassessments, because we reassess a lot of people who's are gonna change from year to year, 6 months to 6 months, and you got our congressional delegation very interested in it. We need the federal government to act, and they rejected what we asked them to do. And so back to the drawing board. So it's not necessarily in our control, other than it's something we can keep working on, and we can make it much.
And I was just the messenger. Many smart people in this room actually did the work, and I was the messenger. So
I got to be in a lot of meetings, so it's I was like,
Yeah. Well, I think CMS might be interested in talking to us. It's the timing of that talking.
So I think we can move on to the next piece here. So crisis call lines. So I will say we have 3 kind of 24/7 responses that counties are required to provide. One is mobile crisis, so mental health mobile crisis. The other is child protection response, and the other is emergency social services. And so typically for the child protection and emergency social services, those are usually funded through levy. And the mobile crisis, most counties that operate this do receive money from the Department of Human Services. So that's typically passed through to the counties to operate that. For Dakota County, all of those services are provided in-house. For Scott County, we contract with Campus Health for all of those. And for Carver County, they actually just moved to Campus Health for their mobile crisis. And they're looking to do the child protection and emergency social services response. And we had been exploring a conversation with them on what does a joint response, a joint like one like when this conversation came up and we had a joint meeting with Dakota to first kind of initiate and explore that. So one of the pieces that Canvas does is they actually contract out the response on that in the evening and on the weekends with First Call for Help. And so they have a contract set in place for that work that's just answering the phone. And then they have staff that they dish it off to if they actually need to go out into the community and make that response. Dakota County also is using their staff right now to provide that evening and weekend piece. So we have a meeting that is going to be coming up on May 13th, where we can look at what would it look like if we actually just had Dakota County provide that 24/7, or why not 24/7? I would say more the evening and the weekend response, that first call for help part. So kind of looking at our budget information, what do we pay first call for help between Dakota and Scott County? What would that look like for handoffs? And I would say kind of what are kind of the threats and opportunities of this? Like, we don't want to get it wrong. Like, this is 24/7 because it's critical services for really vulnerable populations, health and safety. So we need to make sure that we can do that well, but we also know that probably between, Dakota or between Scott County and Carver County, we are paying a decent amount of money to do that work. So what does that look like? And in the evening and the weekend, you've got a little bit of an idling ambulance. There's certainly not all of our phones are blowing up at 2 o'clock in the morning on a Tuesday. So we'll have to look at call volumes and some of those pieces. So our next step is just kind of dig into this a little bit further. We have an in-person meeting where we hope to kind of map out this work in more detail.
So Barb, we must have some feel for numbers. They must have some downtime. It might help fill that, and then we pay them for the service instead of, is that what we're talking about?
That's what we're talking about, is that instead of, we would like take first call for help out of the Canvas contract and insert Dakota County, and then we could potentially pay Dakota County for that. And we'd want to look to see if there's cost savings in that and efficiencies that could be gained across the 3 counties in doing that. So.
Yeah.
Do you have anything else?
Yeah, a little bit of context that I would add is every county sets these services up different and has like a different menu of what they cover. And so we actually did the same type of arrangement with Ramsey County many years ago, where we were the overnight call. The good news is we learned a lot from that. So I think we can take those lessons too and try not to, because there were some rough patches within that. And I think we know what they are. So we would be able to plan for that so that we don't have the rough patches or the same rough patches if we were to do this. The other piece I was going to mention is there's a different model for like evenings. So you could do, after hours, like after work, or just overnights, like a 12 to, I can't remember what the exact range is, but the slowest time is like 12 to 6 a.m. or something like that. Those are so we're going to look at all those different math. We're going to do the math on all these different ideas and different methods. Going out and doing a handoff to somebody that would go out is another part of what we're going to look at. So we have more work to do in this area. I think we've scratched the surface, but we do have some experience to draw from and some that will improve in this part.
What are you paying for Canvas right now? What kind of savings would you project?
Our full contract for Campus Health is around $600,000, but the first call for help piece is smaller, much smaller than that. So I don't have that number off the top of my head, but that is something we'll put.
Perfect.
Yeah. To get there. Yeah. The last one that I think we've been trying to figure out the best way to lean into this is in regards to licensing. So the counties, we have responsibilities for licensing as they relate to childcare, to child foster care, and to adult foster care. And this is an area where we get really, really not any money hardly. at all for, for doing this work. And I think as we think through where we really do have staffing needs moving forward, we're going to continue to see tremendous pressures in admin choices in our child protection area, in our economic assistance area. And so like, how do we think differently about our staffing resources that we do have and really trying to deploy them into areas where we really do need them? And so licensing is an area where we really have delegation authority. So we do the licensing in these areas, but really the state, we make the recommendation on the licensing to the state. The state still has the ability to approve or deny the licensing. We know that there's there's a provider that does this in outstate Minnesota. They have not been interested in moving into the metro county, but that could potentially be something that we look to explore a little bit. The other component of this is as we think about state responsibility and where the state could maybe offer and assist on some of the work that we do, might this be an area where we could potentially do that? So this has, like we said, a lot of levy costs that are on that, but I think we want to continue to think through, are there some collaboration / different ways with our state partners on how this could be done.
So Barb, the state does centers, right? Childcare centers?
They do.
But not the home.
Correct. Yep.
So is that one like we could look at differently legislatively together if the counties were interested?
Yeah, I think that would be the next piece on this is what's legislative, what is done like in partnership. I think we would want to lay out potentially some different paths that maybe don't look exactly like current state. So.
In many ways, this one is less complicated than some of the other ideas, a little more straightforward. And so I'm looking forward to those conversations to figure out if there's some more we can do there.
And there's no state money really in this. It's almost all levy, correct?
Yeah, they have raised the adult foster care from like $500 to I think $2,500 or $2,100. So, but it's not much. It's like compared to our.
Okay, let's, any comments or questions at the moment?
Comment,
Go ahead.
maybe a component of this is that you quantify the cost per license and look at giving it all back to the state. I mean, if they're if they're doing the retail or the larger centers,
Okay,
I mean,
that's a good point.
either pay for this or take it back. And if we have, 3 counties what it costs us versus one is a stronger story.
Right, measure the cost of doing business.
I mean, I think we should be doing across the whole human service spectrum itself, tell our story better.
So we'll bring back what the dollars look like and what was that mean?
And what the legislative or statutory lift would be to give it back. I assume there's something we have to do, but yeah.
Right. I mean, everybody's putting a bunch of file cabinets or file boxes on their front steps.
Yeah, and if that works, I'll drive if that works. Well said.
We're not gonna
tell you.
We can have a full van
library.
load of commissioners
Jane
driving.
and Tom.
So you guys have the takeaway on that one for our.
Libraries?
Libraries.
Katie.
Oh, Katie.
Katie.
Oh, my notes.
Big
are
Katie.
there. All right.
Oh, she did take your seats.
This isn't a long one because this was, we had one initial meeting with all of our library directors, so Dakota, Scott, and County. And that conversation really was looking at how do we collaborate in a sense to provide some cost savings, but also maintain that high level of quality of service that we want in all of our libraries. The group met and said, hey, really, in order to proceed in a way that's going to be fruitful, we need to meet with our own teams respectively and do some process mapping of our collection and development, because that was an area in which we were specifically interested into trying to see if there's some way to collaborate better than what we currently do. So those teams are going to prepare, they're gonna do some process mappings, current state definitions. And then at some point, we haven't scheduled it quite yet, but we'll have a meeting to continue that discussion. So if that's something everybody is interested in, we'll continue with that and do what we can. And we also did have other discussions too about programming and just, there's really nothing off the table in terms of how can we collaborate in this regards.
Just, and to add to that, one of the things that I have a lot of interest in is continuing to raise both with, I think, users, with commissioners and with legislators, the issues that we have around the increasing cost of e-materials. I think there's been some exploration at the state and the federal levels about some legislation, but are there things that we can do to, you know, do anything from raising awareness? Because the public gets frustrated, like, why do I have to wait for my copy of the Women for 15 weeks? So there's a little lack of understanding. And then the budget pressures that we feel, trying to meet the needs of the users and expand our collections. So I just think adding to that mix, whatever you guys can bring back to us in terms of a better understanding on the one end or actual action items would be helpful. Thank you.
One thing, libraries traditionally think of those, that's where you get a book or maybe you can get help or whatever. But they've become a community gathering place. And I, you know, if you were talking to libraries, it'd be interesting to hear how that plays out in the different libraries, different
The
jurisdictions.
differences between.
Well, when you say libraries community gathering place, what does that mean? Carver, Dakota?
I'd imagine much to Heidi's presentation at the beginning, there's probably a lot of overlap, which just highlights the opportunity for collaboration.
Well, I mean, isn't one of the things we've talked about is if the Savage Library was closed, would Kernsville's be open and vice versa, right? And making sure that at least they had quick access on different parts of the communities. And then like sharing some of the early literacy things. I mean, we had that meeting this morning on literacy and things in our earlier work session, but those things could all be shared within the communities if one was putting it together. So I mean, I think they had quite a few discussions on ideas from Jen and company, I think, to try to move some of that forward.
And Jake was also at the meeting. I don't know if you have anything you'd like to add.
Yeah, I think it was a wide ranging conversation. Which is, I think it's easy for every one of these topics to go in that direction. And we actually threw out the idea of what if we, not suggesting that we merge the 3 systems or 2 of the systems, but what if we tried to operate that way? If there are opportunities where we can merge services or collaborate as if we were trying to merge, we should pursue those. Talking to Tom before the meeting, I think this could easily get too big for us to actually do anything meaningful with. So really narrowing down on that collection development piece to start, that's big enough bite for us to take on right now. And then if that works out, to pursue programming and shared staffing wherever that goes. And Commissioner Halverson, I agree, the ebook costs have gone up and up and up since that model started. And there's not much of a mechanism for libraries to be good stewards of the tax dollars.
Yeah, it's really popular.
And it's very fun. Yeah.
Yeah, to service residents want.
Yeah.
I would just add that as you're doing that analysis, I mean, you have 3 of the MELSA counties or MELSA members there. If it's something that should be kicked up to MELSA and MELSA should be doing that for the group, that's a conversation to be had, I think, because that would be even more theoretically, especially with collection development, that should be even more efficient. So I know there's blessings and challenges doing that, but.
Well, and to that point, so there is a joint funding that has gone into a literacy program that our advisory board put together. And so the literacy activities that you're seeing growing is MELSA funded for a joint effort. And then So there's funding coming in from.
I don't know if that's true for ours, because we developed ours years ago, right?
No, there's
the new
there's a new joint program. Every local library system gets to create their own program around it, but there's funding available. And then, so yes, that's a piece of the puzzle that's actually happening. Good, absolutely, yep. And it's in response to that very question of how do we get more of the resources in at the local level? So that was the effort. Mhm.
Can tell I haven't been to Nelson.
That's okay. You started us talking about it, Barb, so I got a report in that we're trying to deliver.
All right, keep on going. Technology and cybersecurity.
Where's the clicker now, or are they doing that?
It's over there.
Oh, okay.
Was the time period where I was afraid to open our email because I thought Connie was testing me.
No.
Well, so that's part of it. So, the CIOs and myself, we met, a few weeks ago and really discussed 3 topics. So IT help desk, cybersecurity and AI. And really it was I thought, good discussion. Dakota has a fairly new CIO for that role, and Scott County has a pretty much brand new CIO. So there's a little bit of learning and trust building that went on. But I thought we had some good areas to explore. So the first area we went through is IT help desk. And what we found is that we're both on the same platform or moving to the same platform. Dakota County is still in-house, and Scott County has already contracted out its help desk services. So one area we want to continue to explore is that learning. We've used ServiceNow for a long time. We have staff who's pretty expert in it, and so we do some knowledge sharing there with how to utilize and get the most out of that platform and how we use it overall. But then really looking at, is there an opportunity for some shared help desk? We already contracted out. We're pretty low volume in terms of our utilization of it. A lot of it's pretty basic support. So we have a meeting coming up in a week, David, to discuss what that might potentially look like. We're actually in the middle of an RFP right now for that help desk that we're kind of dragging out a little bit to see what sort of fruit might come from this conversation. So it was a positive start to it overall. Next one. Next area is cybersecurity. And again, we're doing a lot of the same things. We have, sorry, I know it's forward. We do the internal phishing campaigns each individually. We do something called penetration testing, where basically we pay someone to try and break into our systems. Dakota County is starting to implement multi-factor authentication. Those are those annoying things where you have to click, yes, it's really me all the time, but it's really good for security. We do those same things. We also do annual cybersecurity training and data practices training as part of our organization. And so really the CIOs talked about, they wanted to continue having these discussions about cybersecurity. What could they learn from each other, what they're doing. We want to look at a shared contract for doing that penetration testing overall. We've gone through a couple of vendors here at Scott County of where we really liked what they did. Some we didn't feel like the feedback was that great, while others we thought really did dig in and look at it. We also want to do some cooperative training. One of the big things we have been wanting to do in Scott County is called a bare metal test. So that's if we are wiped out, somebody comes in and we have to back up completely from our backup drives. What is that going to take? What is that planning? Dakota and Carver both expressed an interest in being part of that with us to see what that is. And then how can we do some of that planning together? Because we're going to be doing similar things if that happened to be otherwise. Which leads to the last one in here is we really want to explore some shared training of staff. We had a security incident in late 2019 where we had to, it's called re-image, where basically we took a computer, wiped everything off and had to basically put all the software back on for employees of about 120 employees. And we had staff staying overnight through the weekends to try and get us up and running after we were shut down for several days. That was a lot of work for a few staff who knew how to do that. So we look between the 3 counties and say, hey, we all can follow the same processes. We can train on that. Somebody has an incident, we can deploy our folks to go help out if that incident will arise. We have the training materials on hand. We do a little bit of training periodically, but then we have that force multiplier in the incident that would happen. And then the last area was artificial intelligence. And this is one where I would say we were all at 3 very different places. Dakota County has a finalized AI policy, and they're currently piloting a non-productive AI server to see what they can get within their own kind of works with that, and then evaluating the cost benefit of moving to a production AI server. We have established usage guidelines for AI in the organization and running a pilot with full co-pilot licenses for the org. And then some places are utilizing AI, but not a formal rollout within Scott County. I think really the big thing for us is going to be that shared AI experience. What are different places doing to utilize it? Where are they seeing efficiencies? Sharing those AI policies and trainings among the jurisdictions within here. And I also think that shared experience of where are you seeing it, not just from the IT side, but really that business efficiency side. We're seeing an impact of saying, if we utilize AI here, it'll lead to better decision-making and better implementation of those processes overall. So a couple of things that are pretty actionable out of this, but a lot of it's more of that shared discussion that we're looking to have and that shared knowledge from people who are expert in this.
Jen, in talking to my staff, like Danny said, the knowledge transfer and the relationship building that came out of this with my staff being newer in this area, it's just as important as the specific topics we talked about in this session. So, not the sexy stuff that come out of this meeting, but very important.
Yep.
Very good. You know, I've been thinking about, we, you know, I'm gonna just mention this, we have something called SCALE, Scott County Association of Leadership Efficiency. And we collaborate with our jurisdictions, cities, townships, tribes, whatever. But we, along the way, we've had a culture of collaboration and a high expectation of our staff that wherever you can, seek to collaborate, seek to work together, seek to be more efficient. We as the board expect that you'll be working on that. And so that's a hope, I think, county to county, that as you're doing, that we like that. We want you to be collaborating, working together, sharing ideas. I think we have an expectation as boards that you do be occurring. So this is very good. Okay, other explorations. We have GIS surveyors. That's Brad.
Brad, you just want to update on that? Yep.
Yeah, GIS, thanks, Mark. The opportunity there is on aerial imagery. Both Scott and Dakota both use the same vendor for aerial imagery and photographs. It's called NearMap. And I think our contract ends next year. Dakota County, I think, is right behind us. And so there's discussions about joining together with a joint purchase. And in that discussion, Hennepin County is the other big player that does NearMap, and they are actually right now looking at re-upping their contract. So they've contacted Scott, and I think our GIS manager is going to reach out to Dakota counties to see if all three of us could go in on a contract together. We're all at a little bit different timing, so we might have to arrange the contract that some counties join a little earlier than others, but we're hoping we might be able to get a better price if all three of us join them. So that's it with GIS. Under survey. The discussion there with our two county surveyors is around title examinations and title work. And Dakota County has that service in-house where Scott County contracts that work out. And there's been some discussion, if there is capacity, would there be an opportunity there to tap into some of Dakota County's skill sets? And I know, George, you checked into that a little bit further.
Yeah, so we established a real estate office in the last couple of years. And a part of that, we moved the title work internal. So we do have staff on hand that can do the title work. So the initial discussions with those staff are, yes, they could do that for Scott County. They are able to do that. We would just need to know a little bit more about how much work needs to be done to see that we have the capacity. But they have access to the records. They definitely could do it. That's just a matter of a little bit more discussion on how much you get us in their way. So then the other piece on surveyors was in the past, we had an agreement where Scott County could sign for us and we could sign for Scott County. In the absence of our surveyors, because we had one surveyor per county, we now have two per county. So that agreement has gone away. That may be something we'd be interested in looking at again. There are some issues with having a licensed professional sign off on a plan they aren't very familiar with. Obviously, there's some issues there, but that might be something that we could discuss as well.
All right. Health insurance pool. This is something we've been talking about at great length in our, go ahead.
Yeah, so Through the scale partnership, has been looking at a health insurance pool. It really came about through that group with a number of our cities saying, hey, we have rates that jump up 15% one year, go down by 10%, jump up 8%. And they were looking at what can we do to really try and stabilize those, be part of a larger risk pool, but also critical to that was still having access to some of the data and information, or getting access to some of that data or information. Scott County is self-insured, just like Dakota County is for our health insurance. So we started exploring the feasibility of a joint pool overall. Right now we have 5 cities, 1 watershed district. Scott County and Carver County are in discussions considering participation of this. We just completed a second feasibility study showing what those would look like. None that I've heard have made a final decision on that. And then Dakota County was actually invited to participate in the feasibility study in January of 2026, kind of bringing it in late to the game. And I know that they've been kicking the tires of this, but right now we're currently trying to go through some Department of Commerce and legal review of some of the quirks of our joint powers agreement and bylaws that would govern this. Because one of the things that was important to our board was if we're going to make up 50-60% of the pool when we initially started, it shouldn't necessarily be 1 vote per member when you have some organizations that have 2 employees in the pool. So we've structured it so that it is weighted in the voting, with no more than 40% of that vote being owned by 1 individual entity, and structured so that if more entities come in, it kind of evolves with it. So, example, with the ones that I said are considering it right now, it would be Scott County would have 4 votes and Carver County would have 3 and the other entities would have 1. But we did build it so that it would shift if Dakota County sometime in the future wanted to participate in that. So trying to look at it with a partnership lens, whether Dakota would choose to come in the future or not. But that's one of those things where Andy's been included in these conversations just to make sure you guys are all aware.
So can I also, so one of the hurdles that I recall from my days on Commerce Committee is, and the teachers are trying to do this again, the teachers have been trying to do this for decades, is that the pools do not have the same requirements for solvency that other entities have, that self-insured entities have it through ERISA, or that fully insured members have. And because they have reinsurance, they've got, what do you call it when you got extra money?
Fund balance.
But, yeah, so you got your reserves, right? And historically, pools have tended to collapse because of a lack of solvency, and which has left people uninsured. And for local governments, that gives me pause.
Yeah.
Because the history isn't great. And so it's something I would love a better understanding of as you guys go through this. What kind of solvency requirements not only would we be expecting from regulatory agencies, but in order to keep ourselves solvent. It's a concern, that's all.
So I know that we are working through the JPA and the bylaws that have to be approved by the Department of Commerce. So that's part of those conversations where you lay out those fund balance requirements, that sort of thing, especially with the requirements of having a financial advisor, fiduciary responsibility to the members of the board. We do have requirements for like stop loss coverage within there. So those are all considerations as part of it, because we have had our health shared pool, our self-insured pool since 1992, I believe. And have a 6-month plus fund balance or reserves for that right now. Our partner that's been working with us, the consultant Gallagher, has never had a pool fail. And they've been doing it for quite some time. So they've really been advising us on what do we need to have in those bylaws in order to make sure we do have that solvency requirement as well. Yeah, but valid concern.
Right, any more comments or questions on that one? Okay, solid waste coordination topics.
All right, I'll start things off. Again, my name is Brad Davis, Director of Physical Development. That's a brand new division here. Last fall, we merged Planning and Resource Management with Transportation Services. And it's my understanding we took the namesake of our division from Dakota County. And we have a lot of the same departments as your physical development division, and I understand Olmsted County also has a physical development division, so Heidi, you might be the origin of this.
Maybe.
So we're gonna talk about solid waste management, provide an overview. We got some maps just to show some kind of the key solid waste facilities and infrastructure here across the state and metro. Look at funding, how is solid waste management funded here in the state? And what do we do in our two counties? Just look at trends, and we want to have a particular focus on waste to energy. That's a topic that's, I think, bubbling up in our county, and I know it's been a topic that Dakota County has dealt with, and we want to just share where we're positioned with waste to energy, where we've collaborated in the past, and where we want to go in the future. And our partnership is strong, has already been mentioned twice. Tomorrow we'll be at a kickoff of a new regional facility that our two staffs worked a lot on, and I think that's just a great testament to this partnership. Last week, Dave Magnuson was in front of our board sharing kind of Dakota County's story around landfills and solid waste management. So our partnership is strong. So I just wanted to say that before George and I are going to take team this. Unlike some of the others, we're going to kind of go back and forth. So I'll turn it over to George.
Can we back up two
Yes.
slides?
Here, George,
The next one back. All right.
sorry.
So, again, I'm George Fisher. I'm the Physical Development Director for Dakota County. Unfortunately for you all, I was also the Environmental Resource Director for a while. So solid waste is near and dear to my heart. I lived it for a long time. But I am going to try to provide just some background so we get you kind of on the same page as far as solid waste. So in Minnesota, we have the Solid Waste Management Act, and it basically tells us all what we need to do. It establishes what we call the waste hierarchy. And that's down there at the bottom. Anything from, you reduce something so don't cause the pollution all the way down to landfilling is the last thing you want to do with something. And there's this continuum in the middle. And you'll see right before landfilling, it goes landfill with gas recovery there on the right. And then it says waste to energy. So waste to energy, sending something to like the HERC or somewhere else to become fuel is more preferable according to this hierarchy than landfilling. And that's important as we talk a little bit more about what we do. Now, the Waste Management Act statute basically directs counties to meet some state goals. So we're the ones that have to actually implement the work. And right now, there's two recycling goals for the state. One, 75% for metro counties. Got to meet a 75% recycling rate by 2030. We're not there yet. There's another goal for outstate or greater Minnesota that is 35%. And they have to meet that same goal by 2030. So next slide, please. So this slide just shows you where the waste to energy facilities are. As I mentioned, the waste to energy is higher on the hierarchy than landfilling and their service areas. And you'll see that there are no waste to energy providers currently. The service area lands in Scott County. And there's a little bit of the service area from Red Wing that lands in Dakota County. We do send some of our waste there. So it's 36 miles to get to Red Wing. If we were to go to the Wilmarth facility in Blue Earth, it's 83 miles. And when you look at waste, it costs and creates a lot of greenhouse gases to move waste. So you want to manage it as close to the source of creation as possible. So this is a concern for us because we're supposed to be moving things up the hierarchy. There aren't waste energy facilities that'll take our waste. You see, there's two right above us in Ramsey and Hennepin County, or in Washington and Hennepin County. They won't take our waste. And I'll get into that in a minute. Next slide, please. Yeah. So this slide actually shows you more holistically the waste management system. There's a lot going on here. Suffice it to say, each of those dots represents some part of the waste management system. The one I want you to focus on, if you can see them, are the little red triangles. Those are the landfills. Where are those? Those happen to be where we are. So that's our part of the waste management hierarchy. That's really the last ditch hope, but that's where the waste lands when you can't do anything else with it. It comes to mostly Dakota County. And then there's a lot of other things on there, transfer stations, et cetera. But the red triangles are what I wanted to draw your attention to.
Are the red triangles just municipal waste landfills? I don't see our landfill on there.
Yeah, they're municipal, and there's also one that's shown there as SET, which is an industrial waste landfill.
Okay, so we don't have our DEMCON big demo construction landfill on there.
Or is it under?
It might be buried.
That star?
It could be underneath the star.
I think it might be under a
I
layer.
think it might be under the,
Sure, under the transit. Yeah, okay, thank
Yes,
you.
they hid the landfills on us. There you go.
Okay, there's one more, there's one here, yeah.
Can't mess with Louisville.
Okay, so next slide, please. So the MPCA had a statute that they developed what they call the Metropolitan Solid Waste Management Policy Plan. This policy plan only impacts the metropolitan area. And the important thing to know about this is, it's prepared by the MPCA's, it's prepared by agency staff. But unlike almost all the other environmental rules and regulations out there, the policy plan doesn't go through rulemaking. So you don't have an administrative law judge that looks at this. You don't have a statement of need and reasonableness where you're forced to say the things that are in the rule are needed and reasonable. None of that applies. The policy plan is basically the MPCA writes it. There's some engagement, but there's no other authority that says, no, you can't do it. So that's important to note because that means our coordination on the staff level with the MPCA is of the utmost importance because we need to be talking to them all the time because if they go down a road that we don't like, there's really no way for us to stop them because we don't have an administrative law judge or a statement of need and reasonableness where we can say, no, this isn't reasonable. This isn't needed. So just that's important for you all to know. That policy plan has a number of prescribed strategies in it. And I mentioned before that we have to meet this 75% recycling goal. The policy plan this last time had a bunch of strategies in it that they are requiring us to do. And a lot of those cost a lot of money or take a lot of time. They are requiring us to do grants for reuse, repair, and waste reduction. So we have to give money out. They're requiring us to do grants for transition to reusable food and beverage serviceware in schools, et cetera. So they are saying you must spend money on these things. They're also requiring us to do things like help get people to backyard compost. Sounds like a great idea, except every pound that we put in the compost in somebody's backyard, we can't count as our diversion, so we don't meet our goal of 75%. So there's some conflicting things there. But it's so as I mentioned, it's very important for us to continue to work with the MPCA and talk to them about what goes into this policy plan because we have to implement it. And there are real fiscal impacts to us. And I'll get to the funding here in a second. Next slide. So the state does provide some funding for solid waste management. Right now, they're providing about 30% of what's required for any of the metro counties. The solid waste management tax is out there, and basically that's a tax on all waste management services in the state, whether it's hauling, landfilling, et cetera. And there's different percentages, but they collect roughly $123.5 million a year. And then that's divvied out. And right now, 27% of that just goes into the state general fund. The rest of it goes into the environmental fund. The majority of that stays with the MPCA and about 22 million of the solid waste. Again, this is solid waste management tax. About 22 million or about 17% currently comes to the counties. Now I'll go back to one of my first statements is the state law says counties have to implement these programs. We get 17% of the funding that's generated from the solid waste management tax. And we've been fighting to that. That's been many, many years of legislative action. We've slowly increased the amount of SCORE dollars. We call it SCORE. It's a Select Committee on Recycling and the Environment. We've slowly increased that, but it's far, far less than what we need. Like I said, right now we're getting about 30% of the money we need to fund our waste programs comes from SCORE or other state money. Everything else is some other county source. In Dakota County, it's our Environmental Legacy Fund from host fees. For you guys, it's probably your county environmental charge, or it might be levy for some others, but you have to come up with another source of money. So with that, the next slide here just shows you those SCORE dollars per county. It's based on population. So Dakota County gets about $1.5 million a year. In 2025, Scott County received about $540,000, and every year it's readjusted based on a formula, but it is not going up very quickly. You see, we had a slight jump in between 24 and 25. That was great. I think it was like a 3% increase, but we're far, far short of where we need to be.
So Scott County just gets 541 almost, of the 22 some million.
Right. The 22 some odd million, and I need to be clear on that, that is statewide.
Yeah, that's right. Yep.
But it is, that's a population-based, estimate.
Is it just population based, that division of score?
Yeah, SCAC score is, yeah. So I think the next slide, I'll turn it back to.
I'll take it over and Commissioner, that's why we've sometimes called the score formula an unfunded mandate. So you heard George say, we've got to do certain things, but yet we're not getting all of the money to do those things.
And the important piece on that, so again, it's population based, scoring dollars go out to the rural counties too. Remember, their goal is 35%, ours is 75.
They probably meet that waking up and running.
They could, just with composting,
George, where do we sit currently percentage wise?
We'll show you that.
Oh, I'm getting ahead of you.
Yeah, and Brad lead that off.
All right, I got the next few slides on Scott County data. So this is showing MSW municipal solid waste. As no surprise, as our population grows over time, the tonnage of our municipal solid waste also grows. Currently, our county generates about 80,000 tons of municipal solid waste, so just your common garbage. None of that is landfilled in Scott County. All of that, if it's going to get landfilled, leaves Scott County. And guess what? Most of it goes over to Dakota County.
No.
Yeah. Last count of,
Good money. Make some good money.
Wait till next year.
What is that money?
last count, and I see Nick is here from our office too. You can update me if I'm wrong, but about 40% of our waste went to Burnsville and about 30% went to Pine Bend. And then 25% went to McLeod County. So just so you get a feel for where our waste is going as it leaves Scott County. So that's the top graph. You can also see just some of our trends in organics. We hope by 2030, all of our cities need to do curbside organic pickup. And so we're hoping that that will move the needle a little bit on that green line, the amount of organic waste. And then that bottom line is our amount that was going to waste to energy. And you can see for a while there in 2015, 16, 17, some of our waste went to the GRE facility up in the North Metro. And then obviously up at Upriver, that closed obviously. And that's what dropped our tonnage for the last several years. So we are not sending really any of our waste to a waste energy facility today. And of course, we continue to look for opportunities to change that. Next slide. The next data point is our recycling rate. We're currently at 52% recycling rate. That's pretty close to Dakota County, and you'll see that too, but I think you're about 55%. We're more than the state and metro average, so that's good news, but still have a lot of work to do to reach that 75% goal. Again, I think some of the organic pickups could get us there, but I've heard conversations with you, George, and maybe a little bit you, Nick, other ways you think we can start moving the needle on the recycling rates. Do you have any?
Well, there's a lot of ways we can do that. The issue is they all take money.
May I ask, how do you come up with that number?
Recycling rate?
Yeah, so that's my job here at Scott County. I go through, the state, every hauler is supposed to report annually to the state. I go into those reports, pull out all the data, work with all the facilities, landfill, recycling facilities, and put it all together and come up with that rate every year. So.
Is it a volume or a ton?
It's by tons.
You couldn't send it anywhere other than Burnsville?
We're building a mountain.
It's gonna be higher than Buck Hill.
All right, waste to energy, WTE, you already heard George say there is no capacity here in the metro to take our Scott County waste. And so you need to start thinking about where outstate could this go, but all that costs money to ship it longer distance. We've heard estimates that if we as the county or the metro or several counties were to build a brand new waste energy facility, you can see the price tag here. So that is a big price tag to accomplish on our own. There could, of course, be discussions whether the state of Minnesota could finance something like that to benefit us all. But just wanted to throw that dollar amount out there. We don't have good mechanisms to to dictate where our waste can go. It's called waste designation or flow control. You have to do that by ordinance. And then if you do that, you have to be able to have a public processing facility to take that waste. We can't designate waste to a private facility. So that's another hurdle is finding where we can find a public processing facility. The only one nearby is back in your county in Newport, but that's at full capacity. We're working with Blue Earth County and exploring some ideas with them, but that again would be a private facility. So that's a real challenge, I think, right there. And whether that is a legislative change, I guess is something that we could maybe talk about offline and work together on. So in Scott County, the other way to kind of control where the waste goes is if it falls under the definition of public entity waste. And it's been our guidance that that's waste that is collected by organized haulers. So in our county, only 2 cities have organized collection, Shakopee and Jordan. So that's the only waste that we could designate as public entity waste. That generates about 15,000 tons. So that's the tonnage that we're starting to talk to Blue Earth County and saying, hey, if you are looking for other counties to participate in your flow of waste down to that facility, right now, we think we could look at 15,000 tons. All right, back over to George. I think it was similar data for Dakota County.
Hey, quick question. Do you know of any private entity that would be interested in doing burner? Like Excel?
I have not. I'm looking at Nick or George. Have you heard of any private?
Clearly, they have to have contracts with cities for the waste stream.
There are private entities that are researching other ways to use waste, to create fuel, anaerobic digestion is one of them. But actually just incinerating waste. No. Right, for Dakota County, so I just want to call out a couple of things here. You see, we have a little bit of waste that goes to waste to energy. That is actual county waste, and 2 of our cities, it goes to Redmond. We do spend more in order to do that because we're complying with that public entities rule. We do send our county waste down to Redmond. The other thing that's different on our slide than Scott is our organics and our recycling are flipped. We are bringing in more organics than we are recycling. That's that green line. And a lot of that has to do with the fact that we have some good infrastructure in the county to collect organics. And that number hopefully will go up when we go to curbside. Next slide, please. So this, again, the non-metro goal would have been 35. We would be knocking it out of the park if we were non-metro. We are not non-metro. You see the progress towards 75% is stalled. We've basically done everything we can with what we have in order to increase that. And we're right about at 55%. As you heard, Scott County's at about 52. You know, it's a couple percentage points, probably within the percentage of error of these reports. So right around a little over 50 is about the best we can do with what we have right now. The next slide. This talks about the waste to energy from Dakota County. I mentioned that a little bit of county operations. There are 2 contracted cities as well. That's Hastings and Farmington. And that waste could go to, or does go to get processed. Again, we have to send it all the way down to Red Wing versus bringing it to Newport, which is much closer to us because the Ramsey, Washington site only takes Ramsey, Washington waste, and the HERC only takes Hennepin County waste. So, and then we have a total landfill of 221,000 tons that does go to the landfills within our county. The next slide just shows you a little bit of a comparison. My apologies, the title's wrong. It should say, it shouldn't be volume, it should be weight. This is tons. But it shows you, generally speaking, we got the landfill on the far left, and then we've got recycling on the far right. And the percentages are pretty close between the 2 of us. So it shows that we've both done just about everything we can with what we've got in order to meet that 75% goal. Now, the next slide starts talking about what we wanted to be here for, which is the collaboration. So that was all just background. This one's a little different than the other items that we've talked about for collaboration, that we've been down this road before, but we've re-engineered and reconstructed that road. So it looks different today than when we were here before. So there was this entity known as the Solid Waste Management Coordinating Board that was in existence for a long period of time. It coordinated waste management activities throughout the region, and the categories of those, the topics that they dealt with are on that little table up there. It did disband in 2017 after the administrator for that organization retired. Dakota County used to pay dues, almost $100,000 a year to be a part of that, and they went towards paying for those services that you see there. Scott County was a part of that for about 9 years. It's my understanding, and I wasn't around when Scott County pulled out of that organization, but it had to do with some concerns about the voting structure of that organization. In 2017, when we were looking at the Solid Waste Management Coordinating Board and the administrator was going to change, we brought somebody in that talked to all the commissioners that were a part of that to evaluate the effectiveness of different programs. And as you see up there, that's kind of where they came up with. Of those programs, they said the legislative programs, they wanted to grow those. And as I mentioned before, that's how we get more money. That's how a lot of the activities that we're able to do get funded. That also included working more with SWA and AMC, et cetera. The regional programs operating jointly, we wanted to maintain that. And there were a lot of things that we did jointly, and we've continued to do a lot of those. That includes our regional hauler licensing. We just did a separate JPA for that, so that still happens. Our reciprocal use of our household hazardous waste programs. We continue to do that. We've actually grown that program with Scott County. And then other things such as regional training and things of that nature. Policy development and planning, it's decided that we needed to improve on that. And really that was those frequent MPCA discussions. We met with the MPCA staff, met with the MPCA once a month, and the MPCA came to the swim club meetings every month. So we had FaceTime with them to try to influence this policy plan that they were developing. And that was really important for us back then. And that's why we felt, the commissioners felt it needed to improve because we could do even better. Educational workshops, roundtables, and the communication outreach. They didn't feel that those were as necessary. We're doing things on a regional scale. And we decided, you know what, just do them yourselves and invite others when you have room. Those were things like Swim Club was sponsoring events, or there were regional newsletters and campaigns. And it wasn't, those things weren't deemed to be as important. So again, the things that we're seeing to be the most important were really legislative programs, regional programs, and then the policy development piece. The research I put up there as well, but since this entity went away, I think the research that the individual groups are doing, they're really sharing that with each other. So that's something that probably wasn't as important. So that's where we came from. That's the history of that. Swim Club did disband. Really what happened there is there were 6 entities in Swim Club at the time. Scott County had already pulled out. 3 of those entities right away said they were not going to continue with Swim Club. So Swim Club went away. Those 3 entities that originally said they didn't want to participate in Swim Club turned around and made their own club. Because they were waste energy guys.
Yeah.
Ramsey, Washington, Hennepin. They had a different focus because they ran those facilities. So it made sense that they wanted to go a different direction. That was really why Swim Club saw its end, is because the focus of the entities really started to diverge.
Not because I was chair.
She was a wonderful chair. So, and I'll turn it back to Brad for the current collaboration.
Yeah, so today collaboration does continue, even though the swim club is no longer. So many commissioners around the table here are part of that AMC working group, having these discussions. How do we continue to think about solid waste management more at a regional level? So we appreciate your work on that. And I know that there's some discussion about what that group is going to focus on moving forward. That might be a discussion here once we get into that discussion stage. A lot of education, a lot of partnership with not only Dakota, but all the metro counties, making sure that we have a consistent marketing and messaging program about the importance of recycling, breaking the myths of recycling. So a lot of us use that same kind of marketing material to get the word out on the importance of that. Some of the shared efforts on the resource recovery and some of the grants that George talked about. I know that there's oftentimes discussions about how do we make sure we collaborate or not duplicate some of those opportunities that we're looking at across the two counties. A lot of consultation was happening as we were both updating our solid waste management plans. And of course, the last one there, planning for the new recycling zone plus facility. That was a big one. But there's opportunities for more collaboration. Next slide. I think it was mentioned, I think together we could really continue to lobby hard for a change in the legislation to change that score formula so that counties see more of that money coming back and paying for our programs. Some of the policy plan requirements that George talked about, that's right now set at the MPCA, but maybe through legislative change or some other advocacy, we can start changing some of those requirements. Just always continuing to connect on partnerships. And I think this waste to energy is a current topic that I think our staff has learned a lot already of kind of the journey Dakota County has been on, and we want to continue to learn from Dakota. And then also broaden that. I think another neighboring county called Carver is another county that we would like to kind of engage in this waste to energy topic as well. So that's it. We will go to discussion.
Okay, go ahead. For your list.
Or let's go first.
This.
Question, were you on the team's call? I'm on that group. Were you on the team's call last week when the MPCA was discussing? They didn't call it pre-sorting, they have a new name, for metals, pulling metals out, and they have, a new requirement. And what they were not going to consider is what, SKB already does, where they take, you get the, along with 40% inference bill, we get also, from the HERC, the ash from the HERC, and the metals are pulled out. And we are finding out we are getting 2.5 times more metal out of the ash than what the MPCA is expecting, to pre-sort. I don't know what I can't remember what, I just sort of saw red when they, started talking.
Processing, I think.
Were you were there, Joy? Yeah. The pre-processing?
Yeah.
Yes.
Yeah, for everything that is done in the metro area has to be pre-processed.
Right. So they're talking about adding yet another process.
Right.
And not counting the work that SKB does.
Right.
So in the tax committee today is a bill that's supported by those that have the Hennepin, Ramsey, Washington, Olmsted, whatever those things. And which they're taking score money. So they're taking score money that's going to the general fund for a credit. Meanwhile, holding the little bit that we get flat. Was anybody there to testify today to say that before you give the waste to energy, give us more score? It was, I mean, it seems like it was a bill that just showed up in tax committee, never went to environment. It was on the agenda today, so we better get our rear ends moving. If one of the tax chairs is a co-author, for those that, I smell danger, 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 that those 3 counties that left the group are now making a run at score money for a special credit that will only benefit them.
Thanks for the heads up, Commissioner. We'll start tracking this.
So I have a question about technology. So when we talk about waste to energy, and we were having a side conversation, so you guys might already see this whole thing when we're talking. But where is the technology, like in terms of us being able to actually realize the potential for waste to energy? You know, because that to me is gonna be the ultimate payoff. But where are we at?
Want to answer it, or do you want me to? Oh, go ahead.
Is it a dream or is it a reality?
You know, it's interesting. The waste energy, depending on which technology you're talking about, it can be very efficient. I mean, Even the HERC, despite what you might hear out there, it's very clean.
Yeah.
It's not the polluting, monster that people say it is. And it generates a lot of energy and a lot of heat so where it's at, that works very well. The new technologies like anaerobic digestion that would create, certain fuels out of it, that technology's come a really long way. It's no longer experimental, that's real technology. When several years back, we were talking to a company called Enerchem that was thinking about coming here and doing some gasification. That was a little more on the cutting edge, not quite proven, in the large scale. The anaerobic digestion, it's out there, it's just really expensive. And there are companies that are putting it in the ground, they are building it. And when that happens, you can bring in a lot of different ways. You still got to pull out a lot of the stuff, the metal still needs to come out, et cetera, which is good, recycle that. But they can even, they can use anaerobic digestion for a lot of different things. So the technology is getting better and it can be mass produced now, where say 10 years ago, a lot of it was still theoretical.
Yeah, this is really helpful to know. I mean, because I think in terms of being realistic, I don't know any of us who could put anything that burns waste onto an agenda and get it passed, right? And get it past the public. I don't think that conversation is can be had, but.
Smoky Joe's gotta go.
But
predecessor, right?
it's like,
Yeah.
so
What
what's
did he
out
say?
of reach is the clock.
Smoky Joe's gotta go, my predecessor. Keep
This is
everyone.
helpful to me.
Well, I think
That's
Brad
years
showed
ago.
you
Yeah.
on one of the slides, we're talking to create a new facility, whether it's anaerobic digestion or burn, you're talking. I think the number you had was 1.5 billion.
Yeah.
And some of these, you could scale it, but if it's incredibly small, you're not moving the needle that much. So.
And could I add something, George?
Please.
With regards to the two XL plants, the one in, is it Wilmarth, Brad, in Mankato and then Red Wing, they're just, converted coal power plants. So, in some of these cases, we just need to build a processing facility like R&E owns Newport to process what we call refuse derived fuel to send to a converted power plant. So we wouldn't have to build the burner. We could convert a coal plant, so.
Thank you.
Are these digestion plants? They sing more on more pure organics versus, pull the metal out, of course, but versus like the burner, where that thing spits out more metal than they compare, from what I understand, which is interesting. But where that's garbage going in. First, like the digester, it says that have to be more clean, or more processing, more organics to get that.
In order, that's one of the trade-offs for the different types of technologies. The anaerobic digestion, they like the organic component. When in most cases, we're trying to remove that and have that go to organics or composting. So it does compete for that waste stream. They want that high organic content for some of the.
Which we have to tax that here in Scott County.
With organics, are any cities leading the way in either county? 2030 isn't far off, or are the haulers dictating how that'll be done?
It's a little of both right now. Some of the cities are talking about it. Nobody's leaned forward that far yet. Yet that clock is ticking. The haulers will likely, without a designated or a organized system, it's going to be hard for cities to dictate how that happens. The cities themselves might have to organize in order to say, we want your organics to be picked up in a certain way. Right now, otherwise you could have 5 haulers that want it.
Not organics.
Not okay.
Organics wreck our roads.
Well, the woman was asking of Hastings.
We're disorganized.
Commissioner, we don't have any cities in Scott County that are leading the way. Our approach in Scott County is we'll put the onus on the hauler and tell the hauler it's a requirement by 2030, you have to provide curbside pickup. And then they'll have to just negotiate that with their cities. If they're organized, if they're not, then they'll just, set the price for their customer to do that.
Even if it's more trips on your roads.
Yeah, well, and that's why I'd be very interested in because haulers have to get their technology up to speed. And so I'd almost be more interested, where I've never been a big advocate for, choosing a winner, when it comes to the haulers. In this particular case, they're not all on a level playing field, and so it feels like we should be influencing it a little bit more. For I think what, Bill brought up, but also, to get them investing in the right technology, right? I'm really interested in that, because I don't think everybody's gonna be ready to go. And I don't think they're all investing in technology in smart and efficient ways. And I think whatever we can do to help incentivize, the right kind of technology for organics, makes sense to me.
We have some experience working with the haulers to get into the farm help. Last solid waste master plan, we required them all to go to weekly recycling. And there were some growing pains with them.
Oh,
getting
there's
out there. So they're familiar with us, telling them they have to.
So just, what is the annual, they need more fuel, don't they, when they're building here?
The anaerobic digester.
Yeah.
Washington Ramsey is providing most of the waste stream, but Nick, didn't we learn that they could?
Yeah, I mean, I think they've come to our board and presented that they could use some capacity.
Yeah, they can't meet 50,000, they need our
They're gonna
organic
need
waste
to
stream,
meet
don't they?
to meet what they were, promised to, I guess.
So then the challenge is how to get it sorted and in a higher quality waste to get to the anaerobic digester. That's gonna be the challenge.
Yes, they'll be having those discussions.
Which is garbage.
I think we are. I don't know how much success we're having.
When you have to get the consumer to do it in the first place. I tried it. I don't like it.
Oh.
I'm done.
Is it the odor? Just
What?
kidding.
Well, it's just another trip to another place, another set of bags. It's like,
Or a daily walk.
what?
I said, or a daily walk. If you live in the neighborhood,
Yeah.
or drop off.
Sorry.
Okay, we're ready to move on to our final item.
I thought that was a really good presentation. I think that having conversations about waste is really necessary. It's not just we should, I think it's necessary.
And George, what's the MPCA still hasn't convened the metro area, right? Wasn't that part of our discussion, Brad, on having that working group, which you guys find value in?
Yeah, they were supposed to, one of the required strategies in the policy plan that the MPCA wrote has a state-led strategy that they are to that all of our counties are to participate in an annual joint commission with staff meeting on solid waste. And they have not convened that.
Well, I know that Kate has had conversations. They said May and now it's, I think, July, so I don't know.
But
The state's not following their own plan.
Well, and for the people that are believers of this, why isn't there some continuity across the state? I mean, we're spending gobs of money in the metro and you can't even find a paper recycling bin when you go to a wrestling tournament at Fairville High School. I mean, literally, they don't even have the easiest recycling in Greater. So
Or even at the house, with the Senate or the House,
if I take a mattress in Pine City to the landfill, $8.
Yeah.
I hear it's gonna be $50 here. Well, I got a truck. But once again, the metro's paying so much more than the rest of the state. We're not getting our fair share of score. This is something you would think the 7th County Metro as a group could agree. Hey, give Greater Minnesota a kick in the pants and maybe give us a couple more years to put up curbside organics, because our customers are gonna pay, our streets are gonna pay for a third truck coming around the neighborhood for every hauler. It's
4 trucks in the summer.
Line.
Or your yard.
That's right. You gotta start.
Yard waste, recycling, solid waste, organic.
I have a cliff behind me.
All right, now we're.
Right over the back.
Last item is the round robin, which is
I didn't know.
anything, any topic, anything anybody wants to say. So,
I think Mary Liz has already done that part.
What's that?
She's got a truck and a clip. Taking care of that.
I do have one thing that I don't understand. I think that some of this continuity, whether it's union, non-union salary rates, some of these things, the sticking points are the kind of the unknown or unanticipated things that if you don't start talking about them, you know, how much continuity there is across that. And then sometimes you get so much process that you water down the product. I mean, some of these, the juices are gonna be worth the squeeze, and hopefully we figure out that up really quick. This time's money, and I don't wanna waste a lot of time running down things that we're just not gonna get there. So a handful of high success probability, low investment in time and capital, et cetera, would be those that I'd be most interested in as a start. Dakota's got some other issues they need to be working on as well.
So, can I ask a question about this? Because this is what I was thinking about is our next step. Are we getting close enough to do some math on some of this stuff? Because to me, that's one of the big thing is where's the value, but I don't know if we're ready. Is that kind of where you were thinking?
Well, I don't, in my mind, I don't think we need to do math on all of them.
Okay.
I would see what were the most likely for success and a handful.
Right.
I'm agnostic to what those are.
I think
so.
Someone.
I agree, and I think projects where, I mean, we need staff from both or all counties involved to have that buy, you know what I mean? It should be like, is it gonna give high value, not cost a lot? And the people are invested and not just gonna, you know, fight us the whole way. Like, I think those are the things to start with to prove that there's some real cost savings, efficiency, and it's better for everybody.
What else?
So I'd say not necessarily, some things were very specific, but I think that the investments that we put in throughout 87 counties in technology, whether that be from assessing or from survey, all these things in here, sometimes we're all buying the exact same system and the company gets to go and be the beneficiary of 87 different contracts or 50 of the 87 contracts. And we have some of them that seem like they might be coming close to the right time, whether it be jail management, et cetera. But I think honestly, and maybe it even includes a few of our neighbors, whether that be our neighbors to the south or our neighbors to the north. But I think that there's some things just as an administrative level on what technology and programs we do broader. So I think we have a couple to start with, but there might be some other technology 5-10 years down the line where we just gotta say, we can have a system amongst 5 partners instead of 5 different contracts with the same vendor.
Well, and I think it's easy. I just think having a discussion like this is just a great first step, which is the first step, because I know staff is talking to different departments, but just be aware of some of these things.
Yep.
And the human condition is such that, you know, Scott County has its way of doing certain things. We just talked about Dakota County, and we have our ruts and routines, and we just kind of know what we can do, and it's kind of easy. And we know that most of these things are gonna have some level of hurdles to them. Maybe you're not a hurdler, maybe you're a sprinter, maybe a marathon. I'm not a runner, I'm a lazy sprinter. But I think there is enough that makes sense that, yes, we have Scott County taxpayers, we have Dakota County taxpayers, but ultimately we have Minnesota taxpayers.
Yeah.
And there seems to be some ways to benefit that it makes sense taking time out of 2 counties, looking boards, 2 administrators, 2 staffs, that I think can pay some dividends. So for what that's worth, I'm super grateful that we were able to come together today and have this discussion to kick it off.
I would say that I really appreciate the level of, commitment the staff have given to doing the research has been fantastic, and for the conversation to begin. One of the things that I've been thinking about is, and I'm looking at you, Bart, because I remember when we went to the Family Resource Center in, Colorado. I'm thinking about family resource centers. I'm thinking about the healthcare co-op. I'm thinking about the federal qualified healthcare. We don't have that in Dakota County. Is that a possibility to research? I know that people who don't have the resources, where do they go? And so that's a question.
Especially because our uninsured rate's gonna go up.
Yes, they are.
And
Yeah.
yeah, we don't have a safety net provider in our community. Do you guys have an FQHC?
Open door.
Oh, sorry.
And can I just say one more thing? I am so impressed with the level of comfort in this group. We do talk about the things that we do, our ways, Scott County's ways. But I see a desire in this room, or I hear a desire in this room to really do what's best for our residents. And how is it gonna save us money, and how can we be better? And I really like the way this looks. But there's something very natural about the way that county looks. It looks balanced.
Okay, I've been on record before. I remember an AMC like, hey, Dakota can annex, to me talking, annex us. I love the Dakota name. I love the Dakota font. I don't need Scott.
Wow.
Never been here. See ya.
Aren't you used to be a part?
The origin story.
The origin story of Dakota. Right. And Leslie has a wonderful map that shows the beginnings. We really were together. We came apart, and now there's an opportunity. For us to come together again.
So before we become 86 counties.
That's it right there.
Cheering over there.
I like 86.
There's other counties.
It sounds like there's general agreement that we want folks to take the next step in exploring what the priorities might be. That not everything on this list may make the cut, but we would like to hear from maybe our administrators about here's where we think our bang for the buck is, here where we think we're more shovel ready here, those are, are there other priorities that you guys want to make sure that folks are looking at when they come back to us in terms of kind of big picture? Where are the savings? What's ready to go? Where are our biggest needs?
I have one other one besides the resource centers and all of that, and that has to do with e-waste management. Because with the advent of new technologies and potential for centers, data centers and all of that, is there a way that we could manage the e-waste in a more efficient, effective way? Just a question.
We're getting to where the puck is going.
Yeah,
In
right,
terms of what are the future is.
right.
That's interesting. Go across.
Make it more possible.
You got it.
Oh, I was gonna give you the last word. I thought you were going towards that. Just close this out here.
I got a couple of words.
Oh, you got something to say?
So it goes a little bit to Heidi and Leslie, your presentation on demographics. But as I was kind of going in here, one, these are great topics of conversation. I trust our leadership team that they can go through some of those and maybe come up with some things for our boards that might make some sense. So I think that's the direction that I would echo that we've heard already. And I've just had a little bit of just kind of brainstorming when you talked of demographics, we've talked about both economic development and housing and what that kind of, not necessarily the role of county, but frankly, economic development creates the jobs so that we don't necessarily have the poverty levels that we have. Like we have housing, which makes it affordability. If our housing is affordable, we actually will have more young families that will be able to be supporting our schools and our counties. If we keep driving the cost of housing up, we're going to have less households with kids. So I don't exactly know what the right role of that, because we have to add more partners with our cities and our townships, and it goes beyond that. And it maybe isn't necessarily a cost saving thing, but bringing really a south of the river approach to maybe a future conversation on housing, a future conversation on economic development of this part in here. There's a group that tried something like this called East Metro Strong, that basically was, they tried to get a little bit of Hastings out of that, but it was mostly it was a very expensive proposal and hired a very expensive executive director, but so it didn't really quite fit what we were looking for, because it ended up being very staff driven as opposed to just more of this, how do we go in and make it so that we are a marketable region for families, for housing, and I think I would think a good welcome conversation, since we have a demographic that looks very similar. Above on wealth, above on many of these aspects in here, that maybe some sort of a strategic conversation on what housing in the south of the river looks like, what we could do to attract businesses so we don't have to have so many people jump in a car and leave the two counties. I mean, I think that we have a real opportunity based on some of the data that you shared, since we have so many similarities, to maybe continue a conversation on those 2 points in there. Doesn't necessarily make us more efficient or save us taxpayer money, but might address some of the poverty issue or some of the other demographic issue. And we have two very strong but very different community development agencies. And I told Tony that I wasn't going to go in and say, let's merge them, even though I don't think that's the worst idea. But I think the fact is that what they do is very different. They're not quite alike in how they program, but having that conversation on housing as the south of the river or economic development as south of the river might be valuable.
Along that line, if we go down that road, I'd highly suggest we invite chambers in and present same data. They're the voice of jobs, business.
We can't do that with just two counties.
Yeah.
Well, I think the state demographer is a good one. I think the question that I hear underneath a lot of your answers, what does it mean to have the right demographic balance in our communities? When we were fast growing counties with lots of young families moving in, and some of our cities are still here, there's a lot of infrastructure that's being put in place to meet the needs of those young families, lots of schools, lots of, parks, lots of this and lots of that. If we're going to become, and we're fast becoming a much older community, that infrastructure could become irrelevant. And empty infrastructure an unused infrastructure is a real liability. So again, you're skating where the puck's going. These are interesting queries. And there's good thinkers here, I think, to help.
I don't want to add to the to-do list, but I think the conversation about the senior population that's growing between our two counties, and probably Carver County and other counties. We've talked about the senior tsunami for years, and really nothing has been done to address it. So
you are
right.
right.
Have that conversation.
Yes, you're right. We've been talking about it for decades before my hair was going to the future.
All right, do our administrators want to have comments last readings?
I just want to observe and kind of add on to what all the commissioners had to say about where we go, that what I see as unique and maybe pushing us forward from Dakota County's perspective is that this sets a tone for our staff. You see all of our senior leaders, and I expect it's probably most or all of Scott County senior leaders in the room. It's not that we didn't know who each other were or work each other in various ways, but for the boards to set an expectation, a little bit like what we've heard the chair say about scale. It means something different if we are purposely saying, hey, as a matter of, that's just the way we do work. We check in with each other, we see where we can work together, we collaborate. It means a lot to hear that from the top. And that's notwithstanding what Commissioner Holberg is saying, like, it has to make sense for both counties or for all counties that are involved. But I see it as a way, a little bit of a tweak or a change to the way that we work. And we just keep going. It's not something that we get to the end of our list and now we're done. We keep going. So.
Yeah, talking with Commissioner Ulrich earlier, it's the message, right? I mean, our directors know, and John, they went to a couple meetings where the library director maybe didn't know, and it was like, okay, so it didn't get down from Carver County or whatever the message was. And these guys, this is just a way of life for us. It's reinvent, redo, whoever can do it best, be aligned, right? I mean, I think of the Met Council letter. We could be talking about the Met Council today. Well, what does that mean, right? I see Will's here from the Lower Min. We could be talking about the Lower Min today. And what does water mean? There are all kinds of things that we have and we share and we have supported one another on and worked on it. So I appreciate what you said, Commissioner Slavic, earlier about its control, and people don't like to give up control, right? And so if there are some things that we can do better, I think you gave a pretty clear message, all 12 of you, that we should be investigating these and moving forward. So I think that was really important.
All right, well, thank you for this day, and I hope you. This is, how many years ago was it when we met together? I hope it's something closer to yearly than it was.
Oh, longer than that.
20.
Longer than that.
Okay, whatever. it was.
Wow.
I will tell you though, next time you meet, I hope to be fishing.
I was gonna say, this is a long way to go.